Okay. So we have here a combination of our public speakers and some of our panelists, and that's fine. I wanted to start with these introductory comments. This meeting will be a virtual meeting. We're doing this in part to make it easier for people from across the state to be able to participate. The meeting will be, you can access the meeting on our town hall web stream on the state board webpage, and the meeting will be archived there as well. Only board members, staff, and registered speakers will be able to participate in the discussion as allowed. Board members are asked to hold their comments until the speakers have completed their remarks. Just a couple of additional comments. As you recall, last spring, the state board passed a resolution that said that we wanted to see the return to safe in-person learning for this school year for our children and our staff, and we wanted to do it in a way that would minimize disruption. So that has been our North Star. That is what we have been working towards. Everything related to this topic has been around fulfilling that commitment. Today, we're seeking input from the community, from key stakeholders, health officials, national experts on the state's emergency mask mandate on February the 25th of 2022. It cannot be extended. It cannot be reissued. So the prudent thing for the board to do at this time is to assess how it's going and then begin to think through a thoughtful and prudent way forward. What do we do? For today's meeting, we expanded our normal public comment period. We typically have 10 individuals. We've expanded that to 20. We've also invited several panelists to give the board a cross-section of views on this important topic. We could have very easily conducted this over 2 or 3 days, and I'm sure people would still say, well, you didn't get this person, you didn't get this group. We've done our best to try to bring a cross-section of views. The board is going to be in largely a listening mode. And we will, when we come to the panels, the board will then have an opportunity to ask clarifying questions. I want to underscore, no decisions are going to be made today. At the end of today's meeting, the board will have an opportunity to discuss and to make comments about what we've heard. And then the board will have an opportunity then to review today's meeting, our emails and letters. We've gotten a lot of emails and letters. We have forwarded those to the board members. We invite the members of the public that would wish to send us a comment. Please feel free to do so. Our board reads every one of these. And as we said at our October board meeting, the board will reconvene in early December to decide on a thoughtful, appropriate way forward. So now as we get ready for our public comment period, we're happy to have members of the public willing to take time out of their busy schedules to share their thoughts with us, and we're excited to hear what you have to say. Comments will be limited to 3 minutes. Dr. Simpson will be our timekeeper. When your time expires, we ask you to finish the sentence but not say anything more. Comments should be directed to the entire board and not to an individual board member. And board members will not respond to the speaker's comments, but believe me, we take those under advisement. Now, to our presenters. It's okay to present your views with passion. That's fine. But what we ask you to do is to be respectful and civil in your comments and your actions. If you have witnessed our past meetings, that is something that you see. Even when we don't necessarily come to an agreement, you will note that we treat each other with respect and dignity. And we would ask you to do the same. And you know, after all, we are role models, all of us on this call today. And our children are watching. And I'm amazed at how many people watch what the state board does. The other day, I took my car in for service, and my service technician said, "I saw you." I said, "Goodness." So people are watching. People are watching. So, and once you have completed speaking, we will release you from the room, and hopefully we will not have to release anyone because they have violated the principles we've laid out. We also, as I said, gotten a lot of written comments, so please, anyone that wishes to send us a written comment, please feel free to do so. Send it to the board office, and we will make sure that everyone has an opportunity to be forwarded to the entire state board. We've got 20 people scheduled to speak today, so when you're not speaking, we ask you to mute your phone, and we're going to then call upon the presenters in order. So, and Dr. Simpson, are you ready?
Yes, I am,
okay.
Mr. Craig. I'd like to just make sure that you're able to hear the timer. Okay, so I'm going to set it for a few seconds to.
Yes.
Were you able to hear that?
No, we were not. Perhaps, Dr. Simpson, you could just say time. That would be good, but that's okay.
Are you able to hear that?
No,
Okay.
So why don't you just announce time?
Okay, we'll do.
Okay, great. All righty. So now we're going to turn to our public comment commenters. And again, thank you so much for taking time out. We're very interested in hearing what you have to say. Our first one is Mr. Jared DeCuss.
Good afternoon. Thank you for giving me this opportunity to speak. My name is Jared DeCuss. I'm a father of 2 students in Maryland Public Schools, but I also hold a PhD in materials chemistry and have spent my entire career developing masks for the U.S. Army. So let's say I know a thing or two about masks. However, today I speak as a private citizen. While I trust the board knows this, there still seems to be confusion in the community about the reason for and efficacy of masks. Cloth masks are not meant to protect the wearer. They are meant to protect everyone else in case the wearer is infected. When universal masking is practiced, the occurrence of transmission is reduced up to 90% as respiratory droplets travel only a fraction of their distance. In fact, current projections show that universal masking will reduce the number of daily deaths by the end of the winter by approximately 6 to 7-fold. I think everyone recognizes that fatal cases among school-age children are very rare. However, medically vulnerable students require the layered protection they have been receiving. We also need to recognize that the reduction of transmission amongst school-age children is incredibly important beyond the classroom. These children bring COVID home to their parents, or worse, their grandparents. School-age children currently outpace all other age groups in new cases in Maryland, yet today we're inexplicably having a conversation about increasing the risk posture in schools. Schools are an incredibly unique situation in our communities, in that 20 or more kids sit together in close contact for a long period of time every day. For instance, in our child's first grade classroom, we're currently experiencing an outbreak of at least 4 cases. Each of those cases was directly attributed to unmasked contact between students. Beyond those 4 students, an additional 10 to 12 students have had to quarantine for nearly 2 weeks. Since there was no virtual instruction during this time, it was impossible to maintain continuity of learning for more than half the class. If we unmask students during heightened rates of transmission, though this will become more common, severely disrupting learning for the students. While there may be a tendency to push these decisions to local jurisdictions, this puts undue pressure on local boards of education. For instance, our Board of Education in Harper County has had to deal with many threats in the unruly meeting that when they initially announced they were going to require masks. Many parents want the choice on masks. However, there will be a high correlation with unvaccinated mask students, which is the reasonable parents in the local schools need for time. Parents. It's very complex, and one-dimensional solutions just don't cut it. Without health, these metrics
Because
vaccinations for
we
students,
are
rates of
you're at time. I would suggest also, if you wouldn't mind, if you would submit your comments in writing, because at about with about a minute remaining, there was some disruption. So if you wouldn't mind sending that also to us in writing, that way we can make sure that the board has an opportunity to fully appreciate everything you had to say. And again, thank you so much for that.
Yes, sir.
We'll now move on to Mr. Raymond Russell. Mr. Russell?
Good afternoon. My name is Raymond Russell. I'm a parent of an elementary school student in Worcester County on the Eastern Shore. I'd like to urge you to keep the statewide mask mandate in place in schools for as long as possible until children over 5 have had ample opportunity to be fully vaccinated for COVID, and community transmission of COVID has decreased to low levels across all Maryland counties. The first COVID vaccines for 5 to 11-year-old children in our county just became available late last week, and more families have scheduled their child's first vaccine at a clinic later this week, or are still looking for opportunities to schedule. Please keep in mind that full protection from the vaccine does not occur until 2 weeks after the second dose. That's why I implore you to keep the critical protection measures of masks in schools in place statewide until families with children over 5 have had ample opportunity to fully vaccinate their children. The CDC and American Academy of Pediatrics still recommend universal masking in schools regardless of vaccination status. CDC recommends wearing a mask indoors in public if you are in an area of substantial or high transmission for COVID. Currently, over 60% of Maryland counties and Baltimore City have high levels of community transmission, with the rest are at substantial community transmission according to CDC. Worcester just yesterday went up from substantial to high. With young children only just gaining access to the vaccine, I would like to think that there is light on the horizon for moving past the risks posed by COVID, but we are just not there yet. The science is clear that masks work and are safe. We must continue to use them across Maryland schools as part of a layered prevention strategy. Now is not the time to step back from any prevention strategies when our children are still at risk. Going into winter, with people gathering more indoors and upcoming holidays, there is risk for increased spread of COVID that could not be ignored. Please do not place a child or other Maryland children at risk of increased outbreaks and the potential for classrooms or schools closing. According to the CDC, a study in schools earlier this year found the odds of school-associated COVID outbreaks were 3.5 times higher in schools with no mask requirements than those that had them. If the state were to lift their mask requirement now, then individual districts will diverge, and we'll likely see schools and counties without mask mandates experiencing a surge in COVID outbreaks. Please help ensure schools are open and kids are kept safe across Maryland. Young kids do not mind wearing masks in schools because they know it's important to protect themselves, those around them, and keep them learning in school. Our children are our single most important contribution to this world, and they deserve to go to school knowing that we're doing everything possible to keep them safe. Please stand behind the mask requirement that the General Assembly approved, and please keep that requirement in place until next year, until a high enough percentage of kids have been vaccinated, community transmission is reduced to low or moderate levels across all Maryland counties. Thank you again for doing everything possible to keep our kids safe and schools open. And I'm done.
I'm sorry, I was muted. Okay. Thank you very much for your comments. And at this time, we'd like to have Ms. Kristen Caminetti.
Thank you.
Welcome. Welcome.
My name is Kristen Caminetti, and I'm the mother of 4 children between the ages of 3 and 12. My children attend Anne Arundel County Public Schools. In September, this board did a brave thing. Despite loud opposition from a minority group, you followed the science and the recommendation of the CDC and the American Academy of Pediatrics, and you required all students, staff, and visitors in any Maryland public school to wear a mask. You did the right thing. You should be proud. As a result of your brave and informed decision, the majority of schools and classrooms in Maryland have avoided the closures and outbreaks that we've seen rampant in schools that did not require masks. Throughout this pandemic, we've seen the challenge involved with doing the right thing. It's difficult to measure the positive impact, and yet so easy for folks to point out the negatives. People will loudly say how much they hate masks, and yet countless children and teachers who haven't gotten COVID because of the mask mandates are likely not calling you daily to express their thanks. I am certain that there are parents telling you how awful mask wearing is, how children are suffering daily. No one denies that there are some children for whom sensory processing disorders make it very difficult. And I know there are exceptions for those students, as there should be. But sadly, there are so many parents making masking out to be an equal when it isn't. I am not that parent. None of my children, even my 3-year-old, have any issue wearing a mask. The vast majority of children don't have any problem wearing a mask. I am here to tell you thank you. My 6th grader was exposed to a COVID positive child who sits 6 inches from him in his overcrowded classroom. Because both this child and my son wore their masks correctly, and because my son is vaccinated, he never got COVID and he never had to quarantine. Masking and vaccinations are allowing for the continuation of education for countless children. Yes, many are still having to quarantine and are dealing with the less than ideal instruction provided for students who are quarantining. But without the mask mandate, there would be even more children struggling with quarantines. As we look to Europe and even other parts of the US with relatively high vaccination rates, such as Colorado, are struggling with new surges in COVID cases, now is not the time to relax the mask mandate. Europe has proven a predictor of what will happen here. We can't let our guard down. As children ages 5 to 11 are just being able to be vaccinated and kids 4 and under are still ineligible, now is not the time to change protocols around masks. While many people continue to resist vaccinations, the only way out of this pandemic, it is not time to relax our efforts to mitigate the spread of this disease. Last September, you made a brave, informed, and wise decision. I am so grateful you did. Please continue to follow the science. Please continue to be brave. Please continue to require masks. Thank you.
Hi.
Thank you very much. At this time, we'd like to have Ms. Jenny Kim. Ms. Kim?
Hi, good afternoon. As a mother of 2 children and as a former educator in the state of Maryland, I would like to ask MSDE to keep the mask mandate in place for all public schools at least until the end of the school year. Mask has been working. Taking this mandate away will mean more students will get sick, be quarantined, and lead to increase in staff shortage. Pandemic is not over. We are still in the thick of it. Flu and cold season is back. RSV is spreading quickly in schools and daycares. The spread of these viruses can be limited with the masking of children and our educators. If MSDE moves to give the autonomy of mask mandate back to the counties, we all know that certain counties will immediately eliminate all safety protocols that currently exist to limit the spread of COVID-19. Counties have already lost so many teachers with the opening of in-person learning. Getting rid of this simple mask mandate will increase staffing issues that exist in every single county and put more burden on these teachers who are already doing so much more than we should be doing. Frederick County School Board recently passed updated guidance on quarantine protocol without any public comments nor an advance notice in their agenda. They decided to blindside our community and decide for themselves that students will only quarantine if they were unmasked near a person with a confirmed case of COVID-19. There will be surge of COVID if mask mandate is dropped. Many students are in an older school without proper ventilation in the classrooms. There are so many children in each classroom. Every day, I worry that my child will be exposed to COVID. If mask mandate were to go away, there will be bullying in schools. There is already increase in hate crimes in our communities. This will be a fuel to the fire. With the emergency use authorization of the vaccine, many children are currently receiving their first dose. It will take time to reach full vaccination status that would help reduce the community transmission. We all know that not all children will be vaccinated. Some children aren't able to be vaccinated. If MSDE cannot mandate vaccines, the least that MSDE can do to protect our children and our educators is to continue the mask mandate. Keep the mask on for schools. Keep the mandate for the sake of our children's safety, for our teachers' safety. Masks will help reduce exposure. I want to send my child back to school without worry of bullying and increased exposure to COVID-19. And I would also like to ask that MSDE please hold meetings like this at a time when educators and students can actually participate in. 1 p.m. is an awfully inconvenient time for educators and students to tune into and to make their voice heard on issues that directly affect them in their daily life. Thank you.
Thank you very much. This time we have Ms. Katie Heyman. Can you speak up just a bit? We're having just a little.
Can you hear me now?
Okay. Yes, better.
Thank you. Okay. Firstly, thank you for providing me the opportunity to speak. My name is Katie Heyman. I am the mother of a third grader in the Carroll County Public School System. Masking, along with other mitigation strategies, were put in place to decrease severe illness, death, and to not overwhelm the healthcare system. Since the state of Maryland began reporting the pediatric hospitalizations in September, of the close to 1.3 million children under the age of 18, there has been a consistent decline in pediatric COVID hospitalizations. As of November 14th, there was only one child that is hospitalized for COVID-19 throughout the entire state. We know that children are the group least affected by severe illness and death, and now we know that they are not overwhelming the healthcare system either. At what point will children be allowed to return to the classroom where they're able to flourish as they did before the pandemic? With vaccines available for all people over 5 years old and treatment options, it is time to make masking optional. While instituting a mask optional policy can increase the number of quarantines and classroom disruptions based on the current CDC guidelines, we now have a vaccine available for all students in the K through 12 system. Between now and the new year, many children will have the ability to become fully vaccinated. That being said, I propose that beginning January the 2nd, the following quarantine policy be allowed for those that choose to have a mask optional policy. Children that are exposed, unmasked, and vaccinated will only stay home if symptomatic. Those that are exposed, unmasked, and unvaccinated would be able to remain in school while participating in a 5-day test to stay program that would begin by the counties. So by initiating a plan like this, between now and the end of the year, the counties would be able to have a month and a half to get the plan in place to allow for minimal disruptions while allowing a mask optional policy. Before schools opened, Governor Hogan boasted on multiple national news outlets how he was leaving the school mask decision up to the elected school boards. However, the state board's actions to mandate masks in the classroom and dismiss this statement was a blatant abuse of power. Carroll County has been ahead in many counties in the last year and a half, with our students being some of the first in the state to re-enter the school buildings, providing a mask optional policy for a brief period of time, and by decreasing quarantines with an alternative policy from most of the state. Despite our elected officials knowing what's best for our community, MSDE has decided to usurp that authority. We were told that there would be a reassessment of the mandate every 30 days, and we did not receive a reassessment in October, and there have been no options suggested either. It is time to give authority back to the local school boards where it belongs. We have vaccines for all students, educators, and staff, as well as treatments options available. It is time to do as they are doing in many European countries and to remove the statewide mask mandate and adjust all quarantine protocols so our children can continue to excel without restrictions or any distractions. Thank you for your time.
Thank you very much. We appreciate your comments. At this time, we'd like to recognize Ms. Jessica Garland.
Hi, my name is Jessica Garland. I'm a mother of 5 boys that attend public school in Carroll County, and I'm also a registered nurse. I'm here to urge each member to remove the August mask mandate that was a flagrant abuse of power by your board. Larry Hogan gave local governments the authority to make decisions for their constituents. 97% of school-aged children were already masked at the time you came down with your mandate. All your mandate did was bully the remaining 2 counties that chose to be optional. I'm not going to waste everyone's time today and spew out the numbers like the previous speakers did and the percentages that support the use of masks, and I'm not here to advocate for no masks. I'm not going to campaign for vaccines or denounce anti-vaxxers. I gave up trying to find reliable evidence to support either side. It's not for lack of information. You don't have to look hard to find research to back up whatever cause you're following. There's media outlets and politicians on every corner churning out percentages and rates that will influence the public to follow their agenda. I can find research at the click of a button that can discount or support just about any argument in regards to COVID. And at the end of the day, my brain hurts. There is no clear path to lead our country out of this pandemic. We were told it was 2 weeks to flatten the curve. And 18 months later, that curve is still all over the place. 18 months later, the guidelines from the CDC and their recommendations are all over the place. Science can be complicated and science can be a lot of trial and error. Therefore, I requested the board give us back the freedom to do what is best for our family. Not each family is designed the same. Not each family has the same needs. A family with an immunocompromised child may protect differently with regards to masks than a family with a child diagnosed with autism. Those families are faced with their own obstacles and their unique obstacles to maneuver during this unprecedented time. But neither one of them is wrong. What is wrong, though, is telling parents how to be parents. We know how to do this. We know our children. After all, we made them. There is no greater warrior than a mother protecting her child. These mask mandates prevent some of us parents from protecting our children. I have a special needs son that has struggled with communication from before he could walk. Because I am his mother, I knew it before the doctors or teachers recognized it. My son has spent his entire life looking for facial cues and expressions to help him understand language. And at a crucial age in middle school in which language starts to take the form of papers and lectures, he's been denied that one crutch that helps him understand basic language. My son is not an anomaly. There are many families out there that have a story about masks and anxiety, or masks and sensory issues, or masks and asthma, or masks and communication. There's also families that like the peace of mind of masks. And there's countless kids that don't complain about masks. But this is not a one-size-fits-all pandemic. The masks and vaccine mandates take away our freedom to figure out what fits for our family. These mandates deny our basic right to choose. And then there is risk. And when there is risk involved, there must always be a choice.
Your time is completed. Thank you very much. We appreciate your comments. Thank you again. At this time, we'd like to recognize Ms. Heather Coley.
Hello, yes. Hello. How are you? Hello?
Well, we can hear you.
Okay, I'm sorry, I wasn't sure. Yes, hello, my name is Heather Coley, and I have a high schooler in Harford County. Thank you for letting me speak today. I'm speaking to present a voice to the board for the immune compromised. I am proud of the Maryland school system, and I am not alone. What we are doing is working, and we have consistently had one of the lowest infection rates in the country since schools reopened to prove it. We've had minimal disruption to instruction compared to other states. While it is a relief to see the deaths going down, COVID is wreaking havoc on long-term health. Many people are taking months they don't have off of work to recover, whether that be at home or in a long-term care facility. Now is not the time to let our guard down. I am currently homeschooling my youngest children because they were, until recently, too young to be vaccinated. Myself and 3 of my 4 children have hereditary health conditions that make us high risk. My husband is a 22-year veteran who has respiratory issues from exposure to burn pits during his lengthy deployment, also making him high risk. My healthy, vaccinated high schooler attends in person. Despite being vaccinated with my husband and 2 oldest children, antibody tests revealed that I did not respond well. This is not unusual in the immune-compromised. Every day that I send my daughter to school, I am grateful that everyone is masked to add that layer of protection. It brings anxiety to our family for her to attend in person. Some students are unfairly carrying the weight of their families' lives with them every day, knowing the devastation that COVID caused. But their mental health is also important and severely impacted by the isolation that came with virtual learning. I'm constantly walking the line between balancing everyone's physical and mental health. I'm pleading with the board to help families like mine mitigate that balance by keeping masks mandated until at least spring. We know masks are most effective if everyone is wearing them, especially with some navigating the world as if it doesn't exist. To the point of equity, telling someone keep your kids at home if you're scared is a luxury many parents don't have. They're scraping by financially and don't have the ability to homeschool if masks become optional or take several weeks off of work due to COVID. Finally, I'd like to point out the social pressure optional masking puts on our children. They have opinions that vary as wildly as the adults in their life. The prefrontal cortex, the part of the brain responsible for cognition, judgment, decision-making, and impulse, is not fully developed around 25. Optional masking will present a new problem, bullying. The masks of both sides and students would target each other, especially if masking is based off of vaccination status. They hear the awful things adults are saying to each other all the time. How can we expect children and adolescents to navigate this while learning when we as adults can't get it together? Our teachers will now have to prioritize their jobs as mediators and mental health professionals to their already exhaustive list of duties. Masks keep kids in school, they keep parents at work, and they keep people like us alive. Until we are at least less than 10,000 sales. Thank you. I appreciate it. Thank you.
Thank you very much. Have Akechi Anakawa, did I hate to mispronounce someone's name? Nakawa? We'll move on then. Miss Margaret Barnes.
Hello. Can you see
Welcome.
me? Hi, can you see me?
No, you're not. We're not showing your video.
Oh. There we go. Okay. Hi.
Got you now. All righty, start
Okay.
the timer, Dr. Simpson. Welcome.
Hi. Hello. Thank you for allowing us to speak today. I would like to make a few points that have from some of the other speakers today. I think it's very important to remember that one of the scientific principles that we have is correlation does not equal causation. So just because mask wearing might correlate with rates of infection, in some cases, it doesn't prove that that is in fact true. We need randomized control studies to do that. And in fact, there are randomized control studies that do show that wearing a cloth mask actually increases infection. So I want to make that point. I am a working class single mother, and I do a lot of environmental work. I did it on the Eastern Shore. In my research, it was very clear, and my research said 20 to 50%, children take in 20 to 50% more air than adults because they need that much more oxygen. And that became evident when my son last year almost passed out because of the mask. So that directly affected us, my family, the mask wearing. Last week, I heard a crying mother whose 6-year-old daughter confessed to her that she takes bathroom breaks at school, not because she has to go to the bathroom, but because she hides in a stall and breathes without her mask for a few moments. That's how bad this is for children. I would also like to say that over the summer, the Maryland School Board didn't do anything as far as having a quorum. No one had a health impact assessment to do cost-benefit analysis on the mask wearing of children. I don't think there has been real exploration to weigh the pros and cons of mask wearing. We're just told, because science. And the other thing, especially as a single mother, there's always bully. We parents have been told, wear your damn mask and get your damn vaccine. And, we're being told that by, a governor who's supposed to be serving us. So I'd also like to say that, it doesn't matter how many degrees someone has with their expertises in medical matters, they are still not qualified to determine what is best for our children. Only parents, mothers, are acting purely on behalf of our own children. We don't know what financial gain, political gain, what motives people have for telling other people what to do. But mothers are acting solely on our children. Okay, thank you.
I blew it.
Thank you very much. At this time, I'd like to recognize Ms. Melissa Eidelman. Ms. Eidelman?
Hello, can you hear me?
Yes.
My name is Melissa Eidelman. I'm a single mother of 4 children between the age of 16 and 6. At one point in time, all 4 of my children were enrolled in Anne Arundel County Public Schools. More recently, I pulled 2 out of that school system to attend a small private school. This was due to divisive politics stepping foot in our school system. This was also at the cost of me losing all of my retirement money because I lost my job in October 2020 due to not being able to return from leave as to provide home support for virtual learning. I'm speaking today on behalf of my parents and my local chapter of Moms for Liberty, Anne Arundel County. I'm telling you, this mask mandate forced on us was your solution provided. We followed at the cost of our children and adults' mental health and physical health. Not a single one of you represents me or understands, so it seems, what is going on in my community. The side effects of this mandate has been increased alcohol use, opiate overdoses, and suicides across the state. In my district alone, an increase of murders and suicides seems to be happening. After talking to many parents, I suspect the number of children hospitalizations for mental health has gone up dramatically. In addition to asking you to repeal this mask mandate, it's incumbent of this board to ensure all local school boards know now is the time to get back to normal. You are the ones that need to set this tone and lead by example. I will add some lip here, not just what I wrote. Just personally, it's hard for me to share my personal stories and my kids' struggles. And one reason that is due to many outside Facebook private groups who conduct bullying, where my daughters or my kids will tell me to stop speaking because they're afraid of students that might screenshot information because I've gotten involved. And quite frankly, I'm over it. And I have to teach my kids I'm allowed to have a voice on matters is sad to me because of the bullying that goes on in the parental Facebook world. Thank you.
Thank you very much. We appreciate your comments. I'd like to now introduce Ms. Kit Hart. Ms. Hart.
Okay. Hi, can you hear me?
Yes, we can.
Okay, great. Okay, thank you. Nelson Mandela famously said, There can be no keener revelation of society's soul than by the way in which it treats its children. By that standard, our society now has the soul of an abusive parent. We are telling our children that they must shield their very humanity, refrain from full human interaction, and treat the air around them as toxic. Since the pandemic began, 0.0007% of children in the US have died from COVID-19. Dr. Marty Makary of the Johns Hopkins School of Medicine reviewed over 42,000 cases of pediatric infection of this virus and its variants, and found that not a single child in the US had died of this disease who was not already suffering from a serious medical complication such as leukemia or uncontrolled obesity. According to the CDC's own death statistics, kids are at a 10 times greater risk of dying in a car accident than dying from COVID. While the death of any child is tragic, we need to consider that physical safety is not the only facet of health that should be preserved. A child's emotional, mental, and social well-being are equally salient. The rest of the Western world understands this. The UK, Ireland, all of Scandinavia, France, the Netherlands, and Switzerland have all exempted kids from wearing masks in classrooms. Conspicuously, there's no evidence of more outbreaks in schools in those countries relative to schools in the US. So why aren't we following the lead of these countries? Interestingly, there's been no statistical proof that in the 2 years of covering kids' faces, we have seen any benefit in reducing cases or deaths. The only study that compared groups of children wearing masks to a control group of non-masked students was conducted by the CDC and consisted of over 90,000 elementary-aged children in Georgia. This ambitious and groundbreaking study found no statistical evidence that the mask wearers prevented transmission or illness in comparison to the children who breathed freely. There is simply no reason to mask our kids other than to convince the adults around them to feel safe. All of us know at our core that there is something sinister and cruel about covering the faces of healthy children. The onus is on you to demonstrate that this harsh and drastic measure is in any way in the best interest of our children. What we are doing to our children is nothing short of abuse. The beloved author, Oscar Wilde, warned, "Children begin by loving their parents. As they grow older, they judge them. Sometimes they forgive them. This generation will have much to forgive." Thank you very much for the opportunity to speak.
Thank you very much for your comments. At this time, we'd like to recognize Ms. Sharon Nussback.
Hi, am I on?
Yes, you are. Welcome.
Oh, hi. Can you see me?
Yes, we can see you.
All right, thank you so much. Hi, my name is Sharon Nussback, and I'm from Kent Island, Maryland. And I'm a mom, a grandmother, first generation American Latina. So I'm here because I'm against this emergency mask mandate in Maryland schools. I'm speaking as a grandmother too. I watch my grandkids and I see what they're going through wearing these all day long in schools. There is no emergency order in the state of Maryland. Governor Hogan does not have an emergency order happening right now in the state of Maryland. So I just don't understand how this board has imposed this emergency mask order on our kids. I don't remember voting for any of you to be my governor. Sure, you're all great, nice people, but no. And I really do feel like this is very much an abuse of power. I have a 5-year-old grandson wearing a mask all day long in school, coming home with snot and breathing in his own waste all day. I mean, the mask is I was gonna bring it, but then I thought, no, I better not. So this emergency mask mandate should end today, although I heard you say you're not going to, but it really should. And you should let the parents make the decisions to mask their own children or give it back to local board of eds to. Either way, you've awakened Maryland parents and grandparents like me and families to what's happening with the Board of Ed in Annapolis, Maryland. We will continue to pull our children out of schools. homeschool them if we have to. We'll figure something out, or we'll move out of Maryland, because this lunacy must end. We will continue to push back, gather, share information. We are free people, and our children should be able to breathe air. Let me think. Because we will do anything to protect our children. And we have a United States Constitution, Maryland's Bill of Rights. So please end this mask mandate and make masks optional. Like I said, give it back to local Board of Eds and let them make that decision. And let our children breathe again. It's so sad to watch my grandkids come home and not be able to put these masks on and looking at what these masks look like. It's unbelievable. And I'm just talking as a grandmother, and I don't have the statistics on anything, but I just wanted to come here and let you know that we need to end this now. It's very sad, and it needs to stop. Otherwise, you're going to lose a lot of people. A lot of people are going to leave Maryland. And anyway, thank you so much for letting me speak. Thank you.
Thank you very much for your comments. We appreciate your comments. At this time, we'd like to recognize Ms. Wendy Novak. Ms. Novak?
Hi, can you hear me?
Yes, we can.
I'm speaking today in favor of...
Pardon me, Ms. Can you speak up just a bit, just to make sure everyone can hear you?
I'm speaking today in favor of the mask mandate. Across the state, cases have been increasing for the last few weeks. In Crawford County, our urgent cares and pediatricians are overwhelmed, making it difficult for our kids to see a doctor when they are ill. Our schools are crowded to employ social distancing. Parents who need COVID tests for their children wait days. Throughout the pandemic, our BOE has made decisions against recommendations of the CDC and AAP, and a plea to Governor Hogan in June to lift the mask mandate was no different. Because of the Carroll County BOE's well-publicized lack of responsibility, the school year started with optional masking in Carroll. Unsurprisingly, this resulted in hundreds of quarantines and even the closing of one school in 2 days to catch up on contact rates. The quarantining was so overwhelming that the BOE begged our health department to remove quarantine requirements. Eventually, the health department reluctantly agreed, kept an unmasked situation such as lunch and PE, with the understanding that masking would be enforced or widespread quarantining would be reinstated. Still, our BOE thinks now is the time to remove masks. Even though an American August petition in Carroll County has over 2,500 signatures supporting a mandate, our BOE has shown they cannot be trusted to act in the best interest of our children. They are not enforcing masking during our BOE meetings with the public and children in attendance. Mr. Kyler even stated that he did not understand why he had to mask in a room without children while sitting less than 6 feet away from our student rep. They assert they've done enough to protect their kids. The CDC and AAP would disapprove. Universal masking is part of a layered prevention strategy that allows more students to attend school more consistently and more safely. Removing the mandate will result in more quarantine and more disrupted education time. It will mean schools are no longer as safe as they can be. Many children will not be fully vaccinated until after Christmas, leaving them unprotected in the meantime. Additionally, our school system serves preschool children in our ECSN and pre-K programs. Area high schools also house preschool programs. These children don't have an option to vaccinate yet. Please give them a chance to be vaccinated and for our cases to improve. Today, you will hear from some parents who will tell you COVID-19 is not a danger to our children, but masking is. No peer-reviewed studies support this claim. However, COVID-19 related hospitalizations in children have increased 500% since Delta began. And though this virus is especially dangerous for our most vulnerable kids, 30% of hospitalized children have no risk factors or comorbidities. At a BOE meeting this summer, Ms. Pataglia stated, "We need to learn to live with this disease," and she's right. Learning to live with this disease and following the science and ensuring everyone has the opportunity to protect themselves and their families. And until a vaccine is widely available to all who attend our schools, science has learned that living with this disease means protecting everyone with universal masking. We just need the patience to stay this course until that time. Please protect our children from those who ignore medical professionals. Thank you.
Thank you very much. We appreciate your comments. At this time, we'll recognize Ms. Eileen Charles.
Good afternoon, everyone. Can you hear me? This time
Yes.
starting now? Okay.
Yeah.
Good afternoon, everyone. My name is Eileen Strong, parents of 3 school-age children. I would like to know what are the real reasons that will prompt all of you who are supposed to be caring educators, school officials, to force the children to have their mouths and nose covered 7 hours a day, 5 days a week. Meanwhile, I've seen countless pictures of public officials being maskless at many crowded events and gatherings. You may say, oh, because the adults are vaccinated and children are not. The fact of the matter is, vaccinated adults can still get and spread the virus. And according to the American COVID statistic, children are at nearly zero risk with COVID compared to all things. I'm sure by now you guys probably have received and hopefully read the many emails that parents have sent to you, citing credible studies showing how masks are ineffective and causing detrimental damages to our children's mental and physical development. When you all decide these rules and policies, did you genuinely, in your heart and soul, think about how it can affect these children? Because if you did, you would never impose strict mask mandates on our kids. You would not treat them like disease carriers and rob them their most precious younger years, where they still needed to learn facial expression and how to interpret emotion that are incredibly important in sociology and learning how to live in society. Masks do not work, but you would rather torture and abuse them by making them wearing germ and bacteria infested masks all day so you could receive federal funding. The school realistically is not trained and properly equipped to implement the correct masking protocols. Therefore, universal masking can become hazardous. In the most recent study published by the CDC, proper ventilation and air quality are proven to be the most effective in preventing the transmission of COVID-19 and variants. This finding has been mentioned before in the CDC guidelines of last year. So what has the system done in the past 18 months to make sure all schools have proper ventilation system, like installing ERV ventilator, HEPA filter, or UV lights and ionizers? All of these have been proven to eliminate the virus in the air. Despite receiving millions in funding to help combating COVID, the system has done nothing of this sort on your part. Even the teacher unions was also calling for the school system to improve better ventilation since April 2020, and still nothing. If mask mandates stay, I would strongly encourage all parents who are listening right now, who truly care about your children, prepare to pull your kids away from the system as soon as possible. Between the mask, experimental vaccine, sexual explicit material, CRT, and out-of-control violence in school and punishable, the system is not educating kids to their potential. They are hurting your children. Parents, don't think that you can't do this without the system, because you can. I pray that everyone who mandate and enforce these masks will pay for your crimes in due time. God will not let you get away with what you have done to our children. I am too calling for the exodus of public school system.
Thank you for your time.
Thank you very much for your comments. At this time, we'd like to recognize Ms. Judy Deese.
Yes, hello. Can you hear me?
Yes, we can.
Okay, first I want to thank you all for having me and the ability to voice my opinion. So I am a grandmother of 7 beautiful children, and 6 of them are in school all day masked. By trade, I am a real estate agent, and the reason I bring that up is because there's something we are trained to do. We are servants to the community. I have to offer my due diligence to my clients. So to the board, I'm asking that you, in fact, do your due diligence as well. There are things when I'm working, people don't ask me to do. If I see a problem, I correct it. I'm asking you to do. And the reason I'm asking that is because so you can ponder on them and look for a way to remedy them. I went to the school the other day with my youngest daughter, and my granddaughter Elise came out of pre-K with her mask, and I took it off right away, and she had from her nose to her chin mucus, and her heart was broken because she didn't wipe it or anything. I'm thinking, how many hours did she sit in the classroom, and nothing against the teacher. The teacher wasn't aware. She couldn't see it. And then in the next couple of days, she had a horrible rash that emerged. But she's only 5 years old. She's just a little girl. It's the teacher's responsibility. It's the staff members' responsibility to keep my grandchildren safe. My grandson Zeke, he is also in pre-K as well, and he has got a nasty habit. He is legit chewing on the inside of his mask. He's just a little boy. He's 4 years old. He's chewing on it and he's eating the fibers. You know that these are things that they need to watch out for, right? I have a granddaughter, her name is Haley. She's in the 6th grade, first year of middle school. And we were going for a ride the other day, and she told me, she said, Lovey, it gets so due. I wipe my whole face because she's sweating so much in the school. She's got acne that's coming up now. And I guess that's something the kids have named, I don't know, maskne or something. Also, I have a neighbor who has a little girl in 3rd grade. Well, her teacher has told her, if they have to tell you twice to pull your mask up, you lose your seat in school. You must stand for the duration of the school day. Well, that's unacceptable to me, and I've encouraged her. But she's fearful. It's just a shame. I've listened to some of the parents here and the people talking, and my heart goes out to them because a lot of them are afraid. But you know what? My family. Thank you.
Ms. Deese, one thing you may wish to do is to send us written comments. There were times during your presentation that the screen froze, so we may have missed some things. So if you'd like to supplement that and send along a note, we'd be happy to receive it. Thank you very much for your comments. At this time, we'd like to recognize Ms. Amy Adams.
Hello, can you hear me okay?
Yes, we can. Thank you.
Thank you. Good afternoon, everyone. I would like to say to the board that you spent 16 months while our schools were locked saying that in-person learning was a local decision, and then you jumped to mandate masks over the localities. You refer to the American Academy of Pediatrics about masks, but you ignored their recommendation for in-person learning in June of 2020. This should never have been a statewide mandate. The jurisdictions vary widely in prevalence of the virus, the number of vaccinated citizens, and school crowding. Our children have been under the most restrictions for a virus that does not affect them at the same rates as the elderly and people with underlying conditions. I was recently on a panel with a pediatrician from Sinai Hospital who stated the data on mask effectiveness was referring to surgical masks, not the cloth masks that the majority of kids and school staff are wearing. The cotton masks are not effective in preventing virus transmission, but I will let your panel of doctors explain that data. There is no need to wait to lift the statewide mask mandate for 5 to 11-year-olds to be vaccinated. We now know that the vaccine prevents severe illness, hospitalization, and death. However, we also know that children are at far less risk, statistically 0, for any of these outcomes. The data from the last 19 months around the country shows that school transmission rates are lower than community transmission rates, and the Maryland rates are and have been low for quite some time. Why are we continuing to keep everyone masked in school buildings for 8 hours a day, 5 days a week? Why aren't you openly discussing the negative impacts of masks on children? I would like to know if a local school system applied for and received the ESSER 3 grant funds, does that grant require masking for the remainder of this year? If that is the case, the masking is not tied to public health, but rather money, and that is intellectually dishonest and unacceptable. The majority of school systems in Maryland seem to follow the CDC guidelines as authority related to COVID. How many of you avoid eating raw cookie dough or sushi based on the CDC recommendation? Are schools supporting the CDC recommendation that all children get at least 60 minutes of physical activity a day? Are schools following the CDC recommendation for 30 minutes or less of screen time per week for children over the age of 2? My point is the CDC provides guidelines. When making decisions for our schools, we need you to look at the big picture and consider the whole child. Maryland schools have much bigger issues than COVID to focus on. School violence and safety, years of poor academic proficiency rates, transportation issues, staffing issues, and the terrible quality of food we are serving our children. I'm asking you to end the statewide mask mandate and focus on the bigger issues within Maryland public schools. Give local systems the ability to make the masks optional. Thank you.
Thank you very much. We appreciate your comments. Thank you. At this time, we'd like to recognize Ms. Chanel Window. Ms. Window?
Winlow, that's okay.
Winlow, I'm sorry. Yes.
Sorry. Good afternoon, members of the board. My name is Janelle Winlow, a 15-year teacher. I used to have a passion for teaching and I used to love my job. Unfortunately, that is not the case. I'm hanging on by a thread. Teachers are pleading, from the words of my colleague, this is not sustainable. We've lost several teachers. I need my call, please. We've lost several teachers. Some with no notice because of the abusiveness. The question I asked is, do you actually know how abusive it is? Teachers cover classes of the staff, some as many as 5 a day. They're actually being pulled from their own classes. We're using our contracted time, which leaves more work on our own, some of the assigned classes for the rest of the school year because teachers have quit. Paraeducators have assigned classes. We're being given next Tuesday off, but it's deemed a relief day, but that's a snow day. Just give us a break. It is not sustainable. We're outnumbered by students' behavior. Students cuss, slam doors, yell. One threw a desk, a computer, a chair, and what happened? Nothing, because it was a manifestation and it is not safe. This is not sustainable. Fights are out of control. I'm currently in physical therapy from a fight that ended up on the news. Another case, we had 2 teachers punched in the face. A student sprayed perfume in a teacher's eyes this past Friday. These situations don't even scratch the surface. We're tired of being hurt and scared for our safety. It is not sustainable. Testing is too much. MCAT twice, MAP twice, MISA, social studies. Let's throw summative assessments in there. Testing anxiety for teachers and students is at an all-time high. We're behind on instruction, but yet we need these high test scores, and we don't have time to teach to reach the goals. Something has to change. It is not sustainable. We're also counselors. I think we often forget that our students who were trapped in the house with their abusers for the past year, we become their escape. But they didn't have that escape. And who takes the brunt of the aftermath? We do, the teachers. It comes in all forms. And don't forget about the social media problems as well. Carrying the bulk of the weight of these emotions is not sustainable. Masks are another problem in the classroom. They cause a distraction and behavior issues. Students won't keep them up. And I waste a lot of my instructional time telling them to pull them up, which often results in disrespect, defiance, and non-compliance with them. We have students with severe anxiety pleading for us to take them away. My room is registering at 85 degrees for the past 2 weeks because of a malfunction in the system. My chest was caving in and I felt like I couldn't breathe. The tinnitus in my ears has me to rely on lip reading, as does for my hearing impaired students. Wearing these masks is not sustainable. We need change. I don't want to have to force myself to leave the house in the morning because I can no longer emotionally handle this job. I want to be the teacher that I know that I can be. And as it stands now, and with the direction of education in Maryland, I can't keep going. This job is not sustainable.
Thank you very much for your comments. We appreciate those. At this time, we'd like to recognize Ms. Chantel Mueller. Ms. Mueller. Ms. Mueller. We'll move on. This time, we'd like to recognize Ms. Veronica Golden.
Hello, can you hear me?
Yes, we can.
Okay, I'm sorry, I have poor internet connection, so that's why my camera's off. My name is Veronica Golden. I'm a K-5 art teacher in Charles County, Maryland. I'm speaking to you as an individual. I'm also speaking in favor of keeping the mask mandate. I have a child at home who's 3 years old who cannot get vaccinated right now. I am exposed if children do not wear their masks. I have a potential of 400 exposures a week because I teach everybody in my building, including our special needs and our medically fragile students. The masks have not been a problem in my building. We have a couple of friends who have special cases where they are allowed to not wear their masks at certain times during the day, but for the most part, the kids are fine. I understand that they are uncomfortable. I understand that it causes anxiety, but they are necessary at this time. We have seen what happens when we have removed the masks too soon. If you think about what happened in the spring, once adults started getting vaccinated, and it was a free-for-all when people took off their masks and numbers have gone up. The same thing is going to happen in our schools. We cannot afford to have kids get sick. Currently, they are not affected severely. But we all know how science works, and this virus has evolved enough that my brother, who was perfectly healthy, was spent 30 days in the ICU on a ventilator. Thankfully, he survived and is now home. I do not want to bring something home to my 3-year-old who I can't control. I don't want to possibly spread one of this disease to another child in this building who cannot get vaccinated because they're a chemo patient. I said it is imperative that we put the safety of kids first. They are our future, and without them, what are we going to do? Sorry, let me take a breath. I get a little nervous during public speaking. Excuse me. I just gave up all of my lunchtime to speak today, so I've been anxiously waiting. My kids mean the world to me, my students mean the world to me, and I take it very personally when I sit back and I hear that teachers are being attacked but not caring about our students. We also have our own families to worry about. We have other staff members to worry about. We don't have subs. I cannot take off if I am sick because there's no one to replace me in this building because they are pulling them from our special ed students. We need to do better, and keeping this mask mandate in place is us doing better. Give the vaccine a chance. Let people become fully vaccinated. Let the parents who are vaccinating their kids have that opportunity. Don't jump the gun and remove them too soon. Thank you. I'm sorry. I got to go teach kindergarten.
Thank you very much. We appreciate it. At this time, we'd like to recognize Delane Lewis.
Hello. Hi. Thank you very much for having me. I'm a resident of Harford County, Maryland. I'm here to speak in support of the use of masks in the school setting for such time as public health-based criteria is met. We need to reduce the politicization of this process and rely upon the best available medical information. We are still in the midst of a pandemic, and we cannot lose sight of this. As stewards of our schools, you have a duty to protect all participants, students, teachers, and staff, to protect those that are medically vulnerable, who may not be able to get a vaccine, or even those that are choosing not to get vaccinated. If you do not follow basic public health understanding of COVID transmission, you also open yourselves to liability. Overwhelmingly, students are performing well and complying with mask wearing because they seem to understand better than the adults do that this is what allowing them to return to school, to participate in their extracurricular activities, and to be with their friends. Also, the majority of parents in our community support mask wearing based upon the emails and phone calls that our Board of Education is receiving. As we enter winter, we can anticipate an increase in infections. Your duty is to do everything in your power to support continuity in learning, which mask wearing allows. Your focus should be on supporting local school boards in implementing the mask mandates. And beyond today's decision, I encourage long-term planning that would include instructional policies and infrastructure such as ventilation that was mentioned previously, that would help offer the continuity in our instruction that we are looking for now, no matter what the issue may be in the future. So please continue to require the masks. Thank you very much.
Thank you very much. This concludes our public comment period. I'll ask Dylan, if you would excuse all of our public commenters from the site at this time. And we want to thank you very much. We appreciate your comments, your passion, your ideas, your suggestions, your criticisms. We welcome all of that. And again, thank you for taking time out of your schedule to be with us and to share your comments. We will take those comments under advisement. As Dylan is assisting the public commenters to leave, I'd like to now turn our attention to Superintendent Chaudhary and have him introduce the first of our panels. It will be a video from Dr. Chan, the Deputy Secretary of Health for the department, health department, and then Ms. Mary Gable, Superintendent Chodari.
Thank you. I think you kind of already introduced them for me, but I'll.
Yeah, I guess I did. I sort of jumped the gun.
So,
you know, all this power goes to your head.
We could always do 2 intros. So Dr. Chan could not be here today from the Maryland Department of Health, someone we work very closely with, but she was gracious enough to create a video presentation and just hit on some topics that is relevant to this conversation. So we will play that presentation first. And then right after that, Mary Gable, Assistant Superintendent on my team, will do an update on just where we are currently with data related to COVID, like we have been doing every month, assessing what the conditions look like. And so those are the 2 next portions of our hearing today. So with that, we'll go ahead and play Dr. Chan's presentation first. Thank you.
Thank you. We cannot hear.
The sound is not playing.
Yeah.
We're working on the sound issue now. If you could just give us a few moments. Thank you.
Okay, we will do that. We did dry runs yesterday, made sure everything worked, the sound, the video. Please stand by just a moment. Thank you. Still not able to hear the sound. You want to try to...
Can we move? I'm sorry, President Crawford, what were you going to suggest?
That maybe what we would do is have Ms. Gable present, and then we'll come back to the video if that is acceptable.
We can do that.
Yes, thank you. I was going to make the same suggestion. So
that works.
We'll work on it on this one. Okay, thank you.
So if we can project the presentation, and I see Mary on with us, so we can shift to that first.
Good afternoon. If I just have a second to bring up PowerPoint and making sure I have the right one.
Welcome.
And just checking if you can see the PowerPoint.
Yes, we can.
Yes, we can. Okay, great. Thank you. Thank you. Good afternoon, Mr. Crawford, Mr. DeShields, Mr. Chodari, and members of the State Board. This is an update on the data that we have been collecting, and then specifically the data for November 16th today. So we are going, excuse me, going to be looking at the survey that we collect. This is, the first section will be data that we collect directly from the local school systems. They are updating their data weekly. Actually, they do it on Wednesdays. So this data is from the last collection that we made when they reported data on November 10th. We will be reporting today on vaccinations, screening, testing, and contact tracing, along with quarantine and COVID-19 data. In addition to the data that we're collecting from the local school systems, we also will be presenting data from the Maryland Department of Health along with the CDC. The first is vaccinations. Just as a review of what the vaccination requirements are, vaccinations are required for all staff, including educators, in the districts that you see on the left in the light blue. There are 5 school systems, and on the right are the school systems. There are 19 that are not. Proof of vaccination is required for educators. There are 5 school systems with a yes and 19 with a no. Oops. COVID testing as of 11/10, 6 of our school systems are testing required for all staff, including educators, if not vaccinated, and 18 is a no. Regarding vaccination and percentage of teachers as of 11/10, the data is before you. You can see that in some of the school systems, we had asked originally for teachers that are vaccinated, but some report for their entire staff. You can see that the data is a range up to 93% of the teachers are reported as being vaccinated, and then lower in some of the local school systems. We're going to look at screening, testing, and contact tracing at this time. Screening students and educators for COVID-19 symptoms. We have 10 school systems that are doing that and 14 that are not. Testing, a yes, is for 20 of our local school systems with a yes, and conducting contact tracing efforts. 23 of our local school systems report a yes in that area. So quarantine and COVID-19 data. So I want to point out again as a reminder that this is data that we are collecting from the local school systems. And we have 3 dates here. As board members know that we are constantly adding dates, but this time we are looking a little differently at this data. We are looking at the data from the board meeting on September 28th, the data that we reported to you. We're looking at the data we reported on October 26th, and we're looking at the data actually we're reporting today, but I do want to let you know it's from the 10th, a few days away. The first date, the September 28th, represents the number of staff quarantines reported at that board meeting, and that was from the start of the school year. Between September 28th and October 26th, the second column is representing the change. So if we look at Allegheny County, the first for September 28th, they reported that there were 17 staff that were quarantined. On October 26th, between September 28th and October 26th, there were 18 that were quarantined. And between October 26th and November 10th, there have been no quarantines. So if you look down specifically, as we're going to go, at the October 26th to November 10th, we can look specifically, as I go through each of the slides, of what's occurred. We know that on September 14th, the mask mandate was approved, and that school systems move forward in that data. The data on October 26th is truly representing what has occurred since then. So you can look at the changes. There's a few school systems where it did increase, but most of the school systems between October 26th and November 10th have decreased. For the next slide, I'm going to look at student quarantine data. Again, September 28th, looking at Allegheny, they reported that since the start of the school year, they had 814 students who had been quarantined. Between September 28th and October 26th, it was down to 513. And between October 26th and November 10th, it is down to 260. If you go down each of the local school systems, you will see the numbers, most specifically between October 26th and November 10th, having significant decreases. The next is a set of COVID cases. These are individuals that were reported as actually having COVID. Staff COVID cases from September 28th, for example, looking at Allegheny, 29 were reported on September 28th, reporting since the start of the school year. Between September 28th and October 26th, 27 were reported. And between the October 26th and November 10th, 14 have been reported. Again, like I mentioned previously, if you look specifically down the columns from October 26th to November 10th, you're going to see a decrease in the numbers as we move forward. There is an asterisk on the first slide and on this slide also. As school systems were getting used to collecting this data, in some cases, they weren't reporting from the start of the school year. They were reporting just what occurred in that time frame between the two. So we did some asterisks on those reports. And then the student COVID case progressions by local school system, going through Allegheny again. These are cases, actual cases. 203 reported September 28th. Between September 28th and October 26th, 170 reported. And between October 26th and November 10th, 99 are reported. We will continue to update this, and so when the next board meeting, which is actually December 7th, we will have updated figures for you at that time. The next set of data are the data that we that we gather from the Maryland Department of Health, and also some data from CDC that we're showing you. So the first set of data is the daily positivity rate that we report. Statewide, you can see that the daily positivity rate on October 26th was 3.06. On November 4th, 2.92. And on November 11th, it is 3.26. So a drop a little and a little increase. But again, we want you to see that although there might be in the community, this is community data, this is not school system data. We looked before at the data in the school systems, and cases in quarantine were for the most part decreasing. This allows you to look just visually. So although the data is very small, the numbers are very small, the data is exactly what is here, but this just gives you visually to be able to look at across the board from the state and all of the local school systems, and in particular, you may have a particular school system that you want to take a look at. The next data that we report from, that we gather from MDH, is the 7-day moving average case rate per 100,000. And you can see again, state 12.54 as of November 4th, 11.34 as of November 11th, 12.43. Again, we're looking at this visually, and you can see school systems that might have, that are going down, one report after another. Some might have had a spike, but you can take a look at each of the school systems. This is the level of community transmission over the past 7 days, again by jurisdiction. So this is not specifically, not just the schools, this is the whole school system, the whole county or city, and that's jurisdiction. I do want to call your attention, and if you can't see it, it's small. I will highlight, this is how the CDC classifies the transmission levels. They consider low from 0 to 10 new cases per 100,000, moderate 15 to 50 new cases per 100,000, substantial 15 to 100 new cases per 100,000, and high of 100 plus new cases per 100,000. And what you can see is that we have more and more jurisdictions that are going to substantial or staying at substantial. Some have remained at high, some have gone from high to substantial. But you can see, and I can just let you know, was from the first time we reported this, far more substantial than we had originally. We did kind of summarize this for you. jurisdictions that were high on the first report that we have that we're showing you here, 8 that were substantial, and 2 that were moderate. So overall, as you look at these, the high has gone from 14 to 12 to 10 jurisdictions, and so that's going down. Substantial has gone from 8 to 11 to 14. So we have fewer being high and more being substantial. And as I said before, while what is happening in the community may be high or substantial, overall, our school data indicates that cases and quarantines are going down. So a definition of an outbreak, we're going to talk about an outbreak in a minute, and just I will always remind you of the definition of outbreak. That is 2 confirmed cases among students, teachers, staff within a 14-day period, and these are students or staff that are not related, not part of household contacts. A school-wide definition is 3 or more classrooms or cohorts with cases from separate households that meet the classroom cohort definition over 14 days. So how does that look? The active COVID-19 outbreaks, that's new student cases that are part of an outbreak. In Allegheny, just to look, as of October 27th, it was 93. As of November 3rd, it was 70. And as of November 10th, it's 75. You can see the totals at the bottom of the page, local school systems and other public agency totals of 1,084 to 85 to 764, and non-public schools and childcare 124 to 106 to 138. Oops, it's really, there we go. This also is an ability to see the graph, and you can see where some student cases, the outbreaks over the past 30 days, a lot have gone down, but you can take a look at each of the different school systems that are there. And the dates at the bottom are when we add those dates. This is showing the data. This is all the same data, this slide and the previous 2 slides. So we went from 1,084 to 875 to 764 new student cases statewide in the past 30 days that are a part of an outbreak, and 124 to 106 to 138 for the non-public and child. The active COVID-19 outbreaks for new staff cases, again, the 3 dates that you have before you, Allegheny 8 to 7 to 6, and you can see the totals at the bottom, and you can take a look. Many of the school systems have 0 for those, and for the last 3 dates that we collected that. Again, we're looking at this in a graph, and you can see where some school systems are very, very low, in fact, zeros, and a few have had some, and some have had more than others. And the overall data, 95 staff cases to 101, down to 86, and 39 to 28 to 36 for non-public and childcare. These are the new outbreak counts in the past 30 days. These are the outbreaks that include the cases that I just shared with you. So you can see the school systems, Allegheny had 7 and 6 and 7, and you can see totals at the bottom. Again, this is data that we collect from the Maryland Department of Health. This data, of course, all will be posted on the website for the state board meeting, so folks can take a look at it more carefully. This is looking at the data graphically, same set of data. And as we talked about, 95 to 103 to 112 statewide outbreaks, and 38 to 31 to 45. And that concludes our data update for this November 16th meeting.
Thank you very much, Ms. Day.
Very welcome.
Wanted to keep our session going, but I want to give the board, if there's a clarifying question the board wants an answer to. Otherwise, I'd like to try to keep us on schedule. We have panelists. We've given them approximate times. People have been kind enough to adjust their schedules to be with us, so I don't want to fall too far behind. But wanted to say, which are good so I can see better. Is there anything that burning question issue the board may have? Seeing none, then what we will do is we will go, thank you very much, Ms. Gable. We're going to go to our panel of parents and stakeholder and students. And after our panel, we're going to take a short break. And then we will then move on to the next panel. So this is a panel consisting of parents and students. We're asking each panelist, we're going to give each panelist 5 minutes to speak. We're going to, after all of the panelists have spoken, we're going to then give the board 15 minutes to answer questions. So we'll follow Robert's rules. We would ask the board members to ask clarifying questions, to ask one question at a time. And that way we want to make sure that we give all of the board members an opportunity to speak. When the presenters are speaking, please speak to the whole board. And again, as the public commenters did a wonderful job of being passionate, but yet being respectful and civil. So we would ask you to do the same thing. And panelists, as you talk, if you are relying upon facts or reports, if you can just mention that as apart from informed judgments and experience. So we would appreciate that. That will also help the board to recognize. So I'm going to go and we'll introduce the first set of panelists, and then after that, we'll introduce each one. But the first set will be from the Free State PTA Association. We're honored to have President Posey Moss, Vice President Stewart, and a parent, Ms. Plotz. So we'll start with Ms. President Posey Moss, and Dr. Simpson will again keep the time. And so welcome President Posey Moss.
Thank you, Maryland State Board of Education, for inviting Free State PTA to serve as one of the panelists today to provide remarks about the statewide masking requirement for all public schools in Maryland. I'm Marla Posey Moss, President of Free State PTA, and with me today is Vice President for Advocacy, Laura Stewart, and a PTA PTA parent, Ashley Plotz of Pinehurst Elementary School PTA in Wycomico County, which is located along the Eastern Shore. Free State PTA is the largest child advocacy association in Maryland, with over 20,000 plus members in 17 jurisdictions. We are diverse, we are grandparents, guardians, and comprised of parent leaders, education advocates, teachers, administrators, businesses, and community leaders who believe in making every child's potential a reality by empowering and engaging families to advocate for all children. And for over 105 years, the PTA in our state has served as a relevant source of support for families and schools in Maryland. Now in 2020, and some degree even now, it was a trying time for all PTs in Maryland. PTs have advocated tirelessly to help address food shortages, outreach for mental health and social emotional supports, improve internet device, and advocate for better distance learning. It has been slightly over 100 years since the 1918 influenza flu pandemic. So we're embarking upon cultural sensitivities and factors that impact our air quality. However, as humans, we've been through this before with the measles, smallpox, whooping cough, typhoid fever, yellow fever, rubella, cholera, and diphtheria. In fact, Individual versus public health priorities were first argued among the U.S. Supreme Court more than 100 years ago. In Jacobson versus Massachusetts, a resident of the city of Cambridge refused to be vaccinated for smallpox because he believed the law violated his right to care for his own body in the way he thought best. The court rejected Jacobson's challenge. This groundbreaking ruling in 1905 has served as a foundation for state actions to limit individual liberties to protect the public's health. The Free State PTA encourages the Maryland State Department of Education to require certification of immunizations to prevent communicable diseases as a condition of entry into public and non-public schools, preschools, and childcare facilities. Furthermore, we recognize the need to make provisions for exemptions for medical reasons or for religious reasons. As it relates to the disease caused by the novel coronavirus COVID-19, it is important to implement a multifaceted approach to preventing the spread of COVID-19. Universal masking in schools help because without a mandated vaccination law in schools, schools are subject to increasing vulnerabilities that puts their families and families' health at risk. And fortunately, because PTA is very diverse, many of our parents have diverse views on this issue. According to the CDC, while children are at low risk of becoming severely ill with COVID-19 compared with adults, children can be infected with the coronavirus. They can get sick from COVID-19, and they have short and long-time health complications from COVID-19, and they can spread COVID-19 to others. According to the grandfamilies.org website, there are 41,914 grandparents responsible for grandchildren in Maryland. These children under the age of 18 can provide a substantial risk to older populations should they have COVID. The risk increases for people in their 50s and increases even more in their 60s, 70s, and 80s. People 85 and older are most likely to get very sick. Getting very sick means that older adults with COVID-19 might need hospitalization, intensive care, and ventilator to help them breathe, or unfortunately pass away. Another critical factor that impacts whether students should continue to wear masks at school is the transmission rate. The CDC states that schools should consider levels of community transmission as they assess the risk of transmission within their school. If community transmission is high and community vaccination is low, students and staff are more likely to come to school while infectious and introduce the coronavirus into the school system. According to the CDC, most children with COVID-19 have mild symptoms, or they may have no symptoms at all. Children with obesity, diabetes, asthma, or chronic lung disease or immunosuppression can all be at increased risk for severe illness from COVID-19. Like the
Thank
symptoms.
you, Ms. Posey-Moss.
Yes.
Thank you for your comments.
Thank you. Thank you very much. Vice President Stewart, I'd like to recognize you.
Thank you. Good afternoon, Superintendent Sondry and State Board of Education members. Thank you for this opportunity to address you as the new Vice President for Advocacy for Free State PTA. It feels like a lifetime since I was here there in Baltimore this last summer, speaking on the ESSER funding priorities for speaking on behalf of parents I've spoken to since our schools have successfully fully reopened. Our state PTA organization has not taken an official stance on when masking should be mandated in our schools. So I will share with you concerns I have heard over these last few months and since vaccines were approved for 5 to 11-year-old students. I have been on the Montgomery County PTA's Health and Wellness Committee since the outbreak of COVID-19. Since that time, many parents that are also scientists and health experts have joined our committee. These experts include those whose day jobs include research positions at NIH and NIST, and practicing doctors and pediatric health experts. Even though you will likely hear other opinions today, this group of parents were in complete agreement that the mask mandate should remain until our 5 to 11-year-old students are able to be fully vaccinated. And then decision makers should use COVID-19 case rates as our guide. The science is clear that COVID-19 is airborne, and indoor transmission is best mitigated with a multi-layered approach that includes masks, spacing, high vaccination, regular testing, and proper ventilation and filtrations. Masks are one of 2 mechanisms that can reduce short-range transmission. Further, quoting the CDC, due to the circulating and highly contagious Delta variant, CDC recommends universal indoor masking by all students age 2 and older, staff, teachers, and visitors to K-12 schools, regardless of vaccination status. Recent increases in global settings where vaccination coverage has been high, such as in the UK, Germany, and Denmark, but where COVID mitigation measures have been reduced, have seen COVID-19 cases rise near pandemic peaks, including among adolescents and younger children. As we enter the holiday travel season, while more inclement weather is approaching, it is critical to continue to protect our youngest populations as well as school staff, especially pediatric and medically vulnerable populations covered by the American Disabilities Act. There has been some talk of lifting masking mandates at the end of December, but this particular group believes we should instead reevaluate in February. I also hear from families who have concerns with the continued mandate. Families with children with special education are especially concerned with speech and other development that requires them to see faces. We need to ensure that these children have access to appropriate education and should consider accommodations for these students, including offering more clear masks and conditional waivers. Other parents believe that a highly vaccinated population should be free from mask mandates. But in my daily interaction with parents and teachers, most believe masks should at least be worn through this winter, especially since Maryland's case rates are now increasing and it would be premature to lift mandates. In Montgomery County, the board of directors overwhelmingly supported to send a letter supporting the continuation of this mask mandate. Unfortunately, the issue of mask mandates has resulted in heated political discourse. I believe the state must lead on this issue in order to support our local boards of education, just so they can serve safely. I will end my remarks with advocacy for continued COVID-19 mitigation. Continued mitigation will reduce the spread of this virus in schools and keep more children in school so they can reach their potential. Thank you for all your hard work and making this year safe for our children. My child needed to be back in the classroom. With your continued support, he'll be able to continue growing with his fears, face to face, with the hope he will finally be able to remove his mask safely as we work to overcome this challenge. Thank you so much.
Thank you very much. Mr. Potts.
Hello, Board of Representatives. My name's Ashley Plotz, and I am first and foremost speaking as a parent of 4 young children attending public school in Wicomico County. I am also an active PTA board member serving as treasurer at Pinehurst Elementary School for the past 4 years. As a longtime resident of an area in Maryland where vaccination rates remain low, currently between 45 and 60%, and access to not only COVID vaccines, but healthcare as a whole comes with many complications, our students need continued layers of protection against the COVID-19 spread. Continuing the mask requirements through the winter months allows protection for students who may not have access to the vaccine immediately to become fully inoculated. Additionally, it provides further protection for the youngest students in our hallways, as our public schools host pre-K-4 students who are ineligible for the vaccine at this time. With any hope, with additional monitoring and results being reported, those students would be eligible sometime in 2022. My household is among the lucky. We were able to secure an appointment at a local pharmacy for my 6, 8, and 10-year-olds to receive their vaccine last week. However, many local parents and caregivers find it difficult to get time off work, find transportation, evaluate their own healthcare coverage or lack thereof, and other factors that may delay their children receiving the vaccine. Full protection from vaccination isn't achieved until 5 weeks after the initial vaccine, which means a large portion of our area's population will not be adequately protected before the new year. With our area still suffering from under-vaccination, even in populations who have been eligible for months, I foresee potential spikes in infections and thus hospitalizations if we abandon masks prematurely. Statistically speaking, we are beginning this winter at a higher plateau than last year. With the addition of the Delta variants this year, we are opening ourselves up to a larger relapse in the coming season. Our counties in particular struggle with poverty. Most of our students are involved in Title I schools, which serves populations with 70% of its students below or at the poverty line. We encounter language barriers. We have high populations of migrant workers, adding Spanish, Haitian Creole, Portuguese, Chinese, and Korean students to our classrooms in greater densities than Western counties. We have less broad informational structures and fewer resources than other areas in Maryland. Our hospitals are smaller and less able to carry the load of mass demands. Thus, it would be expected that even as our Western Shore comrades are seeing positive strides in the battle against COVID-19, we lag significantly behind due to factors outside of our control. From an educational perspective, maintaining mask protection allows for students to spend more time in the classroom learning. The lower the infection rate, the less likely students will be exposed and need time off for quarantine and testing. Avoiding disrupted learning should be a secondary goal of masking mandates. The constant threat of exposure, quarantine, and testing creates a level of unease not conducive to focused learning. Please consider extending the mandate into 2022 and giving our area a chance to catch up and not suffer an additional surge in youth COVID-19 cases. I appreciate your time and consideration for this request.
Thank you very much. Our next speakers are going to represent the Maryland Association of Student Councils. We have President Paleska and first Vice President Amadeo. I apologize. I know that I butchered the name. I apologize. But would like to now give you 5 minutes each to make your presentations. Thank you.
Good afternoon, President Crawford, esteemed members of the Board of Education, and Mr. Chowdhury. My name is Justin Paleska, President of the Maryland Association of Student Councils and a current senior from Anne Arundel County. To begin, MASC would like to thank the State Board of Education for allowing the public this opportunity to provide testimony on such an important matter. Providing context behind our testimony, the mission of MASC is to foster a statewide environment for all secondary school students to express and exchange opinions and ideas, develop leadership skills, and promote student representation and involvement in all groups and organizations impacting the lives of students. Students around the state of Maryland are very cognizant of the importance of masks in stopping the spread of the COVID-19 virus. We see it, we breathe it, we live it every day when learning in our school buildings. Just recently, the MASC Executive Board submitted the opinions of their peers themselves in their respective jurisdictions. MASC appointed staff members, officers, regional student council presidents, regional middle school representatives, and local student members of boards of education and regional advisors shared whether they are in support or against the current state mask mandate. The majority of the submissions concluded that our executive board is in support of the current state mask mandate and its imminent safety to the students of Maryland. MASC would also like to recognize that a portion of the students surveyed are against the state mask mandate, specifically in their respective jurisdictions. MASC wants to highlight the importance of the opinions of the whole regional student councils or the whole of individuals on our executive board in this crucial matter. Here are a few of the comments that we received from our executive board, quoted from students and regional advisors. As more of As more and more Marylanders are getting vaccinated, the possibility of removing mask requirements is now within reach. However, it is important to recognize that masks can limit students sent home for quarantine and prevent individuals from being identified as close contacts. I do not believe masks should be mandated statewide and that it should be left up to each individual school district. Each community has different needs, and those needs should be addressed by specific school boards. I believe that there should be a state mask mandate, as it will help the reduce of the spread of COVID-19, since it is very contagious when airborne. Masks will not cause harm and is a more simple method to prevent the spread, so people do not have to worry much about treating it, which will become hard and risky and time-consuming. Specifically, when Thanksgiving and Christmas is coming up, this will become more important for public gatherings, which makes it easier to spread when it gets colder. It is harder to keep windows down for natural ventilation or people in closed spaces, and it will be very helpful to have masks. I support having a statewide mask mandate for schools because masks are still recommended by the CDC in activities where there is interaction with non-vaccinated people. Schools are areas in which the virus would be highly transmittable, and so in order to protect my peers, it would be better to continue wearing masks until the CDC declares that it is okay to not wear a mask everywhere. I believe I believe what my own county is doing with strict mask mandates for both students and staff should not be limited to only my county. I believe in order for us to get over this devastating time and ensure our schools stay open, we must mandate mask use for all school buildings in Maryland. On behalf of the MASC Executive Board, it is our hope that the State Board of Education makes it the right decision for our students' safety and has continued productive discussion on this very important matter. Thank you for your time.
Thank you very much. And now we have from First Vice President. I know I butchered your name. Please help me with the pronunciation. My sincere apologies.
No, you're fine. Good afternoon, President Crawford, esteemed members of the board, and Mr. Chowdhury. My name is Tolu Dapo-Deyemo, First Vice President of the Maryland Association of City Councils, and I am a senior from Charles County. MASC would kindly like to use the time allotted to share some more of the opinions stated by our statewide executive board regarding the statewide mask mandate in school buildings. Here are some of the quotes from students and their opinions. I support the mask mandate. I support it because I am concerned about counties being given the responsibility of a mask mandate and rushing excited to move forward, and cases of spike outing the students at risk. I think it is best to stay in masks until more are able to be vaccinated. I think as of now, masks should continue to be required in indoor settings in schools. Masks are proven to work and will assist in keeping all students safe. I believe that the current statewide mask mandate is crucial for limiting the spread of COVID-19 in our schools. The mask mandate makes me feel safe. Until vaccine rates are sufficient and/or positivity rates are exceedingly low, masks should be mandated. I believe the mask mandate is a good idea. Requiring masks in schools helps take some of the stress off of students who may have an immunocompromised family at home or may be immunocompromised themselves. The mandate is imperative towards the safety of our teachers, students, and faculty. On behalf of the MASC Executive Board, it is our hope that the State Board of Education makes the right decision for our student safety and has continued productive discussion on this matter. Thank you for your time.
Thank you very much. This time we'll move to the Parents' Place, and we will recognize Executive Director Everett Sansone.
Yes.
Oh.
Thank you. Good afternoon, and thank you for the opportunity, Mr. Crawford, school board members, and Superintendent Chowdhury, for the opportunity to be with you today and share comments regarding the mask mandates in schools. I am Renee Everett Sansone, and I am the Executive Director of the Parents' Place of Maryland. But before I start, I'd like to provide a brief background on the Parents' Place of Maryland to help frame my comments. The Parents Place of Maryland, or PPMD, was started 30 years ago as a grassroots family helping family organization that is, and still is to this day, led and driven by families who have children with disabilities and special health care needs. He is the Federation and Health Information Center for the state of Maryland. We serve all children with disabilities and special health care needs across the state. Our mission is to empower families to be their child's advocate and partner with educators and healthcare providers through one-on-one assistance, resources, and training. We serve families with children birth to 26. Our services are free of charge, and we do not care about a family's income, immigration status. The only criteria to be served by us is you have to live in Maryland or be moving here, have a child that a family has a concern about, and we help. At PPMD, we are not medical professionals. We also do not walk a mile in a family's shoes. PPMD does not tell and or advise a family on what they need to do when it comes to their child or their children. But what we do is to provide families with evidence-based and research-informed materials, policy-based materials, and resources, all in a family-friendly format. And with that, families are now empowered and fully informed with all the information they need to make the best decision that works for them. When asked, what should I do? I will give the resources to families. We always encourage families that if they have questions about whether their child should wear a mask, get a vaccine, or anything related to their well-being, they should reach out and talk with their doctors. My comments today are with the lens of this perspective. It is so very important that our children are now back in school and stay there. There are many tools that make this possible. Better and improved ventilation systems, social distancing when possible, vaccines, and masks. Overall, children did not benefit from virtual learning for a variety of reasons. Their disabilities, parents not having the choice to work virtually, lack of access to devices, lack of access to reliable high-speed internet, and etc. While we are so encouraged that vaccines are now available for our younger children 5 to 11, our families, as do most of us, have reservations about the vaccine, but hopefully with time we'll become more comfortable and confident in getting themselves and their children vaccinated. But in such time, all tools will need to be available to keep students, staff, and teachers safe so they can stay in school for in-person learning. While all struggling with the loss of in-person learning, our children with disabilities have significant levels of aggression as well as social emotional challenges. Some of our children struggle to wear masks, so they need their individualized instruction and support to address these many challenges. A quick review of some facts. While Maryland has done a great job of responding to the pandemic, we are still not out of the woods. Per the CDC COVID tracker, Maryland still shows substantial community transmission, which is the second highest rating on the transmission rating scale. We are also experiencing variants that are significantly impacting our children, which was not necessarily true when COVID first started in 2020. We also know communities that experience poverty have higher rates of infection, as do our communities with greater diversity, either due to a historical mistrust of the medical community and or do not have the privilege of working virtually. COVID has fully shined a spotlight on the health inequities and disparities that exist in Maryland. And until we reach the critical threshold of the population being vaccinated, we must use all the tools available to us to keep our children in school. At PPMD, we do understand that this is an emotionally charged issue, but we would like the school board to hear and consider all facts to help keep our children with disabilities and special health care needs safe, healthy, and most importantly, in school where they belong. Thank you.
Appreciate your comments. At this time, we're going to hear from parent, Mr. Benjamin Heiser. Mr. Heiser, welcome.
Thank you. Can you hear me okay?
Yes, sir. We can.
Okay. I am a special agent, so I generally go facts-based, and I also try to validate everything that I always hear from parents. However, I am coming to you as a parent and not representing the government. First, we need to actually look at it through the lens of, is this currently a threat? And Dr. Makey wrote a piece for the Wall Street Journal, just shy of 40,000 kids. And it basically said that no children really passed away without an underlying condition. Here are the current numbers per 100,000 kids. They have a 2.1% chance to pass away due to cancer, 1.9% due to vehicle accidents, 1.5% due to suicide, which is rising right now, 0.7% to homicide, 0.5% to drowning, 0.3% to flu, and 0.002% to COVID. So why on earth are we actually even having this conversation other than the highly charged, politicized environment of which we find ourselves in today? Now, let me share you a really heartbreaking story that a parent told me in person, and it shattered me. She had a 5-year-old girl, and she was always taught not to interrupt class, to listen to the teacher. She actually felt sick and she vomited in her mask. She was too afraid to take it off. She was then sent home by the school nurse, and her own mother was told to keep an eye out for aspiration pneumonia. As a parent, this is absolutely heartbreaking. And I know as far as my child, when she comes home, or both my daughters when they come home, their masks are absolutely disgusting inside. So let's look at the psychological issues that are going on. As of right now, there are 0 psychological studies in the U.S. that are being done as we speak, which is very, very concerning. We're literally putting a muzzle on our children. 80% of how we communicate is from body language, micro and macro facial expressions. And now we're basically taking that out of the equation. My youngest daughter, she's special needs, and because she can't see the teacher's face, she's learning by tone. And as I speak to my daughter, she'll interpret the tone as something maybe bad, and she'll start crying and say that she's sorry. And this is just one of the byproducts to having a mask on. She's very confused, and rightly so. This borderline second-degree child abuse, and that's under Title III, subsection 6, 3-601. It really does ride it, and it rides it very closely. I challenge everyone here to wear a mask all day long, inside and outside. Try to keep it from fogging up your mask, from your glasses, as most children have a very difficult time with. Both my girls have just started to wear masks. And just started to wear glasses, and they won't wear their glasses because it's more of a distraction with it fogging up. Make sure that you eat lunch if you're wearing a mask, and then after you eat lunch, go on about your day. And at the end of the day, see how much food is actually in that mask, and that you've been breathing that in. And this has been one of the largest attributes that have been going on right now as far as the spread of croup. And there's also been a very large spike in our county. As of right now, I've seen a variety of masks, including the mask with the window for children with special needs. And I would like to warn all parents that even though that mask seems to be, a good idea because you get a viewing window, it creates less surface for air to enter in. And it actually creates more of a terrarium than it does of anything else. I know, I've tested it. I really think that this board should reconsider their stance on masks, because if the CDC basically said that they recommended children walk off a cliff, we would all have to sit there and wonder, what are they thinking? And we have to come to our own logical conclusions. I think the board is actually ready to take that step. And I thank you for actually being willing to put yourself out there and to take that step and to put the CDC aside and actually look at what we as parents are actually experiencing. It's scaring our children. It's petrifying our children. It has a huge psychological impact on our children. And our children are still getting sick. They're just getting sick with different things. Thank you very much. And I yield back my time.
Thank you very much. We appreciate your comments. At this time, I'm going to now open it up to members of the state board who ask clarifying questions. It's in a track of around 15 minutes or so. I want to try to make sure but also give the board members an opportunity. So following Robert's rules, we will ask the board members to ask one question. You can ask it of an individual panelist, or you can ask it of the panel. But one question, we have 14 board members. So we want to try to make sure numbers to ask. I am using the grid, but because we have so many people, I don't have everybody on the same grid. So I need you to help me if you can just speak up, and then I'll recognize you. That way I'll make sure I recognize you, okay? Do we have any questions? I'm scanning now, looking to see. Mr. Bartley. Yes, sir. Mr. Bartley, I think you may be muted. I can't hear you.
Thanks. Thank you for your comments. I appreciate them. I think Renee Avaretti Sanzoni, Parents Place of Maryland, made comment. Is that correct?
That's correct, yes.
All right. I have a question for her. You serve children with disabilities and healthcare needs across the state. And Benjamin Heiser pointed out that his special needs daughter is having a difficult time learning because of the mask requirement and her inability to see a teacher's face. Is your position for special needs children with disabilities that they should also still wear masks, or what is your position on masks, just to be clear? Thanks.
Great question. Thank you. Yes. So our position is that it's individualized. And that's the reason why children have individualized education programs. And so if a child has a great deal of difficulty wearing a mask or being able to access their education, or for whatever reason, that is a conversation that needs to happen within the context of that child's individualized education program, and that the team works together to support the child in whatever works best for that child being able to access their education.
Thank you.
You're welcome.
Other board members, clarifying questions? Ms. Chang?
Yes, hi. I do have a question. I think it's general. I know that a couple of panelists addressed it, that there are something observed once the child went home and take away or remove their masks. And I'm just wondering, is there any proper education, how to wear it, how to care, or how to place the mask? I use it. Or do you kind of swap for healthcare by night, and then we have to wear a mask, 12-hour shift. That is challenging, yeah, but we will be able to manage our time. I'm just wondering, I know some students might be at younger age and needs assistance from adults, such as teachers or paraeducator or any available bodies in the school system to help with that. Thank you.
Thank you. Open up to the panelists. Any of the panelists wish to address?
I can address it if you like.
Yes, sir.
Okay, so as far as overall guidelines, as far as Harford County, the guidelines have been very slim, and I can tell you what I found out through multiple studies, which really should be widely available: Canada, Finland, the UK. The best way to actually clean them is use Dawn dish soap and not to put them in your washing machine and dryer. That's like the absolute worst thing that you can possibly do, but parents have no idea about them. They also don't know about the proper selection of masks because some of them do carry arsenic and some of them do carry formaldehyde, those that are made in China, as well as some that are also made in Singapore. Without these types, and it's not a one-size-fits-all either. These masks, especially for small children, very, very, very difficult to get your hands on. If you go on Amazon, it's a wait list for like a month and a half. So parents are just grabbing whatever they can. They have zero ideas to what's a good fit and what's not. Now, let's take it to how do we deal with these young children later off in the day when they have issues, because one of my children chews through their masks. Well, then the school will provide a paper mask. That mask is a lot less form-fitting, creates gaps on the sides. Apparently my children like to chew through them even better than the regular masks, but that seems to be what happens when the teachers actually notice it. However, most teachers generally don't notice it because, well, they're trying to teach. They can't be teachers, nurses, everything all in one, but we're asking way too much from our educators. When they come home from school, yes, somebody spoke about, having that rash right there. For the first 3 weeks, my oldest had that rash. Also a stained shirt, even though I washed the mask repeatedly before having her wear it, it actually went down her neck and stained her shirt. So there's no public set point, which I really would encourage the state to do for all counties to access as to what is a proper protocol and procedure for selecting a mask, washing a mask, and how often you should use a mask. For these younger children, I feel like they should be switched out far more often if they have to wear them, which I'm totally against them wearing. But if you maintain this mask mandate, I implore you that they should be wearing just more than one mask throughout the day, because they also tend to chew on them, so they get wet. And teachers can't see that they're wet due to different colors and variations, things like that, that kind of mask that moisture. And before you know it, this child's waterboarding themselves. And I'm not trying to be graphic about that, but that's just kind of how it is. So I really would appreciate if the state, if they have to, if you all come to such a horrible conclusion to go with the mask mandates, that you do put out a proper guidance for this, for all parents, because we just don't know. It's trial and error, and unfortunately, our children are paying the price of our errors. But thank you.
Thank you. Ms. Chang, you may want to also reserve that question. We have representatives from MAPE and the teachers, as well as health experts coming up, where you may want to. Yes, Ms. Watts, please.
Hi, I also just wanted to speak to the question that was just posed by Ms. Chang. I feel like our county, which is Wicomico County, we're basically in the center on the Eastern Shore. It is perhaps a benefit of ours that we have resources in place due to our low income levels and our students who may not have access to appropriate masks. Our community foundation of the Eastern Shore is a local nonprofit, and they support the 3 lower counties. They actually provided a mass giveaway where they ordered specific masks and gave them away for students, and they came with a leaflet on proper mask wearing, and they also encourage students here to change masks at lunchtime, which would be a time where, hopefully partway through the day, where the students would wear a mask for the morning. Our students receive mask breaks periodically throughout the morning and are able to change them then as well. And so I just wanted to add the perspective that we do have resources in some counties. It probably is not across the board in Maryland for proper mask usage. We also have a access point on our class dojo from our local schools that provide guidelines as to how students should wear masks, including how they should or could fit down a disposable mask to better suit the gappage that happens on the sides of their face. My two youngest students do struggle with a disposable mask. We use primarily cloth, and we do wash them in the sink. But they generally twist the straps and make sure the nose piece is settled over their nose. So I think it would be great if we could get some general guidelines if we continue our policy further. A page that described proper mask usage would be wonderful if put out by the state board.
Thank you.
Thanks.
Any other clarifying questions from the board? If seeing none, I want to thank our panel of parents and students. We greatly appreciate your comments, your suggestions, your criticism. We will take all of this into account as we try to come up with a thoughtful way forward from where we are today. And again, thank you for taking time out of your schedules to be with us. At this time, we're going to take a 7-minute break, and we're going to then come back to the third panel, which will involve state organizations. So we're going to take a 7-minute break. Please hustle out and hustle right back. Again, thank you very much, everyone.
This is a test for video and audio. Please stand by.
Okay, Dylan, you going to give that a try?
Yes, sir.
All righty, sounds good.
Give us about 15 seconds.
Okay.
And President Crawford, can you confirm if you can hear this audio and video now?
Will do. No.
I'm sorry?
We cannot.
Yeah, well, a bit of delay.
Okay. Hold on one moment.
Hey Dylan, can I try something to see if it works?
Yes, sir. Go right ahead.
Give me a moment. Clarence, let me know if you can hear this. I just want to try something. Can I screen share? I can.
Yeah, and I'm going to stop sharing momentarily. Absolutely.
Okay. Let me try something. See if it works.
My name is Dr. Jinling Chan, and I'm the Deputy Secretary for Public Health.
Yes, we can hear that, Mr.
Maryland Health. And I thank you for having.
Can you hear that very clearly, Clarence, on your end?
Very clearly. So why don't we do this just before we go to the national
So, yeah, you can have me take over tech support.
I'm not sure that I feel comfortable with that, but nevertheless.
I just solved it for you. I just solved it.
You did. You know how difficult these board members can be.
Just remember that during my evaluation.
Okay, so what we'll do is we'll do just before we go to panel.
you.
That's fine.
Trying to behave today.
Okay, we'll be coming back in just a couple of minutes. Seven, so that would be another couple of minutes and then we'll get started. Good to see you, President McGraw. How are you doing?
Fine, thank you so much. Good to see you as well.
Great. And happy to see the other local presidents from May. Wanted to have here. If you can take down the video. Let me please take down the video. Thanks. We're going to be starting, coming back now, asking everyone to come back now, and we're going to then welcome our guests. Wait just a minute more for folks to come back. I think we're about there. Okay. Well, it is my distinct pleasure and honor to introduce representatives from May. We're very honored to have President McGraw, who's president of May, and also president of the Charles County Board of Education. We have President Herbert, who is president of the Carroll County Board of Education. Welcome. And Chair Scott from Baltimore County Board of Education, and President Williams from Washington County Board of Education. We're very honored to have you here with us. President McGraw, we'll turn it over to you. We'll ask you to try to with your folks to try to complete everything in about 15 minutes. So we will be gracious if you need a little bit more time to do that. So I'll turn it over to you, and then please start however you have prepared.
Sure.
Thank you.
So good afternoon, Chairman Crawford, or I should say President Crawford, Superintendent Chaudhry, and members of the board. One slight correction, I am Vice Chair of the Charles County Board of Education. One slight is Tina Wilson, who is our chair.
Oh, I apologize. I'm not trying to create dissension.
Chairman creditors do. But thank you very much for this opportunity for us to speak with you this afternoon. Our group today represents a cross-section of the state. And so each one of us will speak about what is happening in each of our counties. So Charles County has had a mask mandate in place since our return to school on August 30th, 2021. And this decision was made in conjunction with CDC guidelines as well as our health officer, Dr. Diana Abney. But the decision was also driven by a resolution by our county commissioners that requires indoor mask use for both vaccinated and unvaccinated individuals. So Charles County Public Schools require masks for anyone that's inside of a Charles County Public School building. And this applies to everyone, including individuals that are already vaccinated against COVID-19. We also require that they warn on CCPS transportation for our bus drivers, our bus attendants, and any student that rides on a Charles County Public School transportation vehicle. We do follow the data very closely, and we seek to keep our community very well informed. We had a daily report up until recently, a daily COVID report, but moved last week to a dashboard, an interactive dashboard on positive COVID-19 cases that are reported from students and staff. The data also includes cases that are reported to CCPS with a lab-confirmed positive result, and it's updated weekly on Fridays. Our website also features a feedback form for our community because we do want to have interactive presentation with them. To date, the mask mandate has had little or no disruption to student engagement and learning. We do offer a virtual learning option, and as of today, 529 students are in grades K through 12 are enrolled in our virtual learning program. I do want to add that we also have in our county 27,000 students as of September 30th. We have no specific concerns at this time, and we are in support of the mask mandate. We do suggest, however, that close monitoring of the data regarding the number of cases among younger students is warranted as the vaccinations become available to the population of students as the mask regulation is reviewed. So I appreciate the time, and would turn my time over to Makita Scott, who is the president of Baltimore County Public Schools.
Welcome.
Thank you so much. Hope everyone can hear me okay. Wonderful. I'd just like to say good afternoon and thank you all for this opportunity to participate on the panel. On behalf of my colleagues on the Board of Education of Baltimore County, I want to thank the State Board of Education for their tireless efforts on behalf of students across the state of Maryland. So I'd like to say for the most part, the implementation of the mask mandate went well in Baltimore County Public Schools. Students adjusted quickly to the requirement and most staff did as well without issue. Given that it was a new requirement, like with any new routine or content being introduced in schools, it is required frequent reinforcement and reminders. School staff are working with students to ensure that they wear the mask over their nose, and at the secondary level, making certain that they aren't taking them off during transition times as they connect with their peers. Students sometimes forget to bring their masks to school, so while the school system provides schools with supplies of masks and other PPE, the supply can quickly dwindle at the school level if you are providing dozens of students with masks every day. BCPS also had a small but vocal group of parents who said they would absolutely not send their children to school in a mask. They would not comply and challenged the school system to actually send their children home for failure to comply with the mask mandate. What we found was that it was more of the parents using that opportunity to vocalize their displeasure with the mandate. Many of them did not actually follow through on the threat, and in the rare occasion where it was a disruption to school operations, we had our safety managers who were able to work with school leadership to devise an appropriate plan. We also dealt with, and we continue to hear from vocal and upset parents at board meetings who've come to provide public testimony about why masks are bad for their children, and parents have come out to demonstrate at our meetings with picket signs. A small number of parents requested mask exemptions for their children. They submitted doctor's notes. Staff from BCPS School Health Services would follow up with the pediatrician in the offices to confirm if the child indeed needed an exemption, and in almost all of the cases, the doctors would share that the child actually did not need an exemption, and they were writing those notes at the request of parents, but did not have a medical reason why those students should not be able to wear a mask. So one of our more positive surprises, though, has been that we've had with this process is that more of the students with disabilities have been able to consistently wear a mask without issue for most of the day than was initially expected by staff. And the same with our youngest learners. They've tolerated it very well and have taken it in stride. One area of concern for us is that the mask mandate will be seen separately from all COVID-19 precautions. So if we take away the mask mandate but stay in our overall pandemic response, contact tracing, quarantine, isolation of cases, it will impact BCPS's ability to keep students in school 5 days a week, given that the science has shown that the virus spreads easier, more quickly, without the presence of masks. So if the state board should decide to relax the mask. I'm sorry?
Just ask everyone to mute their phones. I apologize for the interruption. Please continue.
Oh, okay. Thank you. Should the state board decide to relax the mask mandate, we believe it would be prudent to look at how the overall school pandemic response requirements could be relaxed simultaneously. Another area of concern or questioning for us is around long-term impacts of masks and the overall pandemic response on students' social, emotional wellness, behavior, and academic process. We know that kids' mental health crisis is at a critical point, but what we don't fully understand yet is what that means for school systems across the nation as we're all trying to address the needs of our students and this new normal. So we would ask that when the state makes a determination on any potential pandemic response changes, that you seek the input of local superintendents, health officers, and staff who are working on the ground, working with students every day, and can speak to the impact that these policies have on the work they do with students and to keep staff safe. So I'd also just say BCPS is the third largest school system in the state with 175 schools and centers. Staff have done a tremendous work to ensure the state's mandate was implemented with fidelity and to make certain that our schools and centers are safe and healthy places for students to learn. So I just would like to thank you all for this opportunity to provide examples and share our experiences with the mask mandate.
Thank you. Who's next?
Next, we have Marsha Herbert, who is president of the Carroll County Board of Education.
Welcome, President Herbert.
I think she's muted. Whoops, sorry about that. Okay. Good afternoon, Superintendent Chaudhry, President Crawford, and board members. Hello, I am Marsha Herbert, President of the Carroll County School Board. Governor Hogan on March 13th opened the schools for 2 weeks to flatten the curve and to ensure we kept our healthcare system from being overrun. Governor Hogan also stated he is in favor of local control. All of our counties are so very different. One size does not fit all. Our students for the past 18 months have suffered school closures, hybrid learning, quarantines, mask wearing, loss of learning, emotional and mental stress in the name of protecting adults. We are only one of 8 countries in the developed Western countries to mandate masks on our students in school. Carroll County Public School System had a robust summer recovery program with mask optional. Carroll County Public Schools did open with an optional mask mandate, but CCPS complied the day after the mandatory mask mandate was instituted. There was an immediate increase in home and hospital students. Currently, we have 2,400 students enrolled in that program. We usually average 800 a year. Educators have to deal with non-compliance of masks every day, regardless of a grade. And also, we cannot forget the bus drivers that have to drive and implement the mandate on the school bus also. On October 4th, we had such a large number of quarantined students. We worked with our health officer, Ed Singer, and we did make a significant change in our quarantine. And at the end of October, the State Department of Health also followed suit. CCPS on November 11th sent a resolution to the State Board of Education to remove mask mandate and to retain local control. Mask wearing should be a parental choice along with vaccines. Carroll County has a very large parental group that want parent choice. I am personally made a statement at last week's board meeting that the mandatory mask mandate should be lifted on January 3rd. The vaccine is available, the vaccine is very accessible, and the supply is available, which would not be any problem. Parents who want their children vaccinated will have the chance to get both shots and be fully vaccinated by January 3rd. Some of our concerns are, first of all, you did not follow your own words that you would revisit and review the mandate monthly. And we're not sure, I'm sitting in the Board of Education central office right now. Why do we require our employees in central office to wear masks? It's an office building. And these are some of the concerns we had. Why do we require teachers at the end of the day to wear masks at faculty meetings? Why do we need masks on maintenance workers when they are working on lawnmowers in their shops? And why do we need masks in the gym when a child is on the sideline or a parent sitting in the stand? Vice President Kenny Cotter sent the State Department a letter several weeks ago about these concerns and received no response. On November 11th, there were 0 children in an ICU bed with COVID, and I'm very thankful for that. Remember, that's why schools were closed, to keep hospitals from being overrun. We know that the vaccine is highly effective in preventing severe illness. There will be breakthrough cases, but that allows us for an off-ramp. Our off-ramp should be to remove the mask mandate to our students. What a great gift that would be to our students at the beginning of the new year, and see their smiling faces. A new year, new hope, and we do need to take the burden off of our students. And I really thank you for my time.
Thank you very much for your comments. We appreciate those.
And our last speaker is Elizabeth Williams, who is chairperson of the Washington County Board of Education.
Good afternoon, everyone. President Crawford, Mr. Chaudhry, board members, thank you for this opportunity. Washington County Public Schools serves approximately 22,000 students and employs approximately 3,000 individuals. Some who live in Maryland, some in Pennsylvania, and some in West Virginia. Our school system is governed by an elected board of 7 and is managed and operated by an experienced, tried, tested, and true superintendent. We are united here in the goal of keeping our students and staff safe and in our work together to ensure continuous, full-time, in-person instruction for our students. The Washington County Board of Education holds local authority and governance as a core value. The Washington County Board of Education and the superintendent of WCPS abide by state and federal laws and regulations. Not all board members here agree with the emergency regulation requiring universal masking, but the majority does. Currently, the community level of transmission in Washington County is designated as high. Our county's average for fully vaccinated individuals age 12 and older is 61.7%. This is below both Maryland's and the national average. Today's positivity rate in Washington County is 10.46. Our school system has consistently followed the recommendation of the CDC and our state and local health departments and continues the use of layered prevention strategies. Again, our goal is to keep our students in school receiving in-person instruction. We really thought we would be able to begin the 2021-2022 school year with masks being optional. During summer school, the positivity rate and case rate were at a low, and the COVID-19 state of emergency was lifted on July 1st, 2021. We felt optimistic. However, on August 17th, 2021, our superintendent announced universal masking in hopes of avoiding mass student quarantines. Our school year began on August 30th, and there had been a significant increase in COVID-19 cases over the 6 weeks leading up to the start of school. Yes, there's been pushback from some parents who believe masks should be optional and are a matter of parental choice. We hear repeatedly from a group of parents. We hear from them regularly by email and also during public comment at our meeting. We've heard from the parents and community members also who thank us and support us in the wearing of masks and for our efforts. When the State Board of Education approved the emergency regulation for masking, Washington County's positivity rate was at 8.11 as compared to the state's of 4.92. The case rate per 100,000 was 32.91 as compared to the state's 18.19. Our positivity rate on September 14th, 2021, when the emergency regulation was approved by the AELR committee, was 8.43. Again, our current positivity rate in Washington County is 10.46. That's concerning, very concerning. I've been told that the wearing of masks has become routine in Washington County public schools. Some students continue to need reminding, and yes, some have pushed the envelope when it comes to compliance. Is the wearing of masks liked? No. Are there challenges surrounding the mandate? Yes, absolutely. Masks are made available to students and staff daily. Every day throughout the day, fresh masks are available. In Washington County, we all want what's best for our students. We want them safe, healthy, and in school learning under the best possible conditions. Our employees want to be kept safe, and they deserve to be. And there is always the concern for doing our part to control the community spread of the virus. Again, thank you for the opportunity.
Thank you very much, President Williams. Appreciate it. Okay. Comments from May. This time we're going to turn to President Bose from MSEA. President Bose.
Good afternoon. It's been a long day so far. Good afternoon, President Crawford, Vice President DeShiel, Superintendent Chaudhary, and members of the board. My name is Cheryl Bose, and I'm a 4th and 5th grade teacher from Baltimore County, serving as the president of the Maryland State Education Association, proudly representing over 75,000 educators in numerous job classifications across the state. On this 100th anniversary of American Education Week, I want to take this opportunity to thank our dedicated public education employees, especially you, Ms. McCusker, for daily going above and beyond for our students and families. This year, above all others, is for most educators has been the most challenging year they've experienced. We are facing crisis levels of personnel shortages in all areas. Educators and students are trying to reacclimate themselves to being in school all day long, while at the same time working to offset school closures, virtual and hybrid learning, loss of family members and friends, life completely changing as we still try to find normalcy throughout this pandemic. With increased demands and pressures combined with extreme increased disrespect, educators are reporting across the state that they are barely hanging on. There is urgency to try to keep the dedicated educators we have as we try to recruit people to the profession. We thank all educators, but they really need more than thanks. They want to be respected and heard. They need ever increasing work demands lifted so they can not just survive, but instead thrive and be there for their students so that they can succeed. I know we're here today to discuss the mask mandate, but we're hoping for the same discussion opportunity placed on the dire conditions for education employees. On March 13th, 2020, for Marylanders, our world as we knew it changed, and each day we struggle to find a new normal. Here we are 613 days later, and we are still grappling with issues that we never dreamed of having to discuss and trying to find normalcy. It's very reminiscent of life following the tragedy of 9/11. How we travel, especially fly, throughout this country and world has changed forever. We've adapted for our own safety and the safety of others. I do believe there will be adaptations we make from now on as a result of this pandemic, not only for our own safety, but for that of others, such as increased focus on adequate ventilation systems in our schools. Let's be clear, we are not out of the pandemic. We've lost over 763,000 Americans, and our children have lost over 144,000 parents or caregivers, and the numbers grow each day. These are chilling statistics that impact real lives, and we must do everything in our power to reduce the loss of life, the trauma our students, families, and educators all are struggling with. As President Crawford stated in his opening remarks, I believe we all have a shared goal for students and educators to be engaged in daily, in-person learning and instruction in our schools in a healthy and safe manner. From the onset, on considering how to safely return to in-person, MSEA joined with the Maryland PTA and BTU, stating that in-person instruction must occur in a healthy and safe manner that includes layered mitigation strategies, hand washing, hand sanitizer, social distancing, ventilation upgrades, contact tracing, COVID testing, and masks, as recommended by health and medical experts. Layered strategies, vaccinations. A very high percentage of vaccinated support proof of vaccine or negative COVID tests for all personnel. We are thankful that vaccines have been made available now for all children beginning at age 5. But we recognize that there are still many children who are still not vaccinated. The supply is recently limited, and there are still inequities within Maryland as to how and who can access vaccines. We strongly encourage everyone to get vaccinated and for vaccines to continue to be accessible. I have to say, I personally thought about this debate on masks. Masking is a straightforward mitigation protocol for the wearer and those around us. In our classrooms, it's about the best for everyone. If a parent shares that a student has a nut allergy, everyone refrains from bringing in nuts or snacks that may put that child at risk. I've never witnessed anyone objecting to not bringing nuts for the safety of a classmate. We foster a caring and safe environment for individuals and the collective, and the wearing of masks and other mitigation protocols are no different. We have students and educators who are immune compromised or live with family members who are. We can't always see the health risk or need of someone else, but we can wear masks for everyone's safety. So as we strive to remain engaged in in-person education for the betterment of students, we support an extension of the mask mandate, allowing for a future decision and discussion. We are seeing transmission rates are on a slight uptick, and with the holidays approaching, we will need time to assess the risk. Additionally, with the shortage of school employees, we see class sizes on the rise. Students lax on distancing in hallways and in cafeteria because they're so excited to be with each other. Masks help in these situations. The mask mandate also helped more students who may have considered or been forced due to health risks to take part in virtual learning to actually have the opportunity to participate in person. Students want to be with their friends, we want to be in person, and the best way to safely do this is to be masked. The extension of the mandate will also alleviate the cliff effect.
Thank you. Your time has expired.
Oh, I thought that a group had 15 minutes if they didn't bring other speakers. I apologize.
No, what we were trying to do was to accommodate. We left it up to the individual organizations, whether they had one or multiple. We were just trying to figure out a reasonable way to go forward.
Do this.
Thank you very much. At this time,
extension of the mandate will also alleviate the cliff effect.
Thank you. Your time has expired.
A group had
15 minutes of video.
Sounds like someone may be viewing the live
Somehow we
stream.
got my loop. If you could mute your devices, everyone. At this time, I'm going to ask Dr. Simpson if she wouldn't mind reading the statement from the Public School Superintendents Association of Maryland. They had a statement that they wanted to have read.
Yes, good afternoon. Dear President Crawford and Superintendent Chaudhry, on behalf of the Public School Superintendents Association of Maryland, I am pleased to provide the following comments regarding today's board discussions about the current mask mandate. In short, we believe the issue of masking and other risk mitigation strategies should be guided by reliable scientific research with an acute consideration on keeping as many students in school as possible. When the mandate was instituted in August, we were facing a much lower level of staff and student vaccinations, the height of the Delta variant, and awaiting approval of the vaccine for 5 to 11-year-olds. While many of these circumstances have improved, a key element, justification, in the modification of the quarantine guidelines center around students being masked. Therefore, if there is any change in the board's support of the mandate, we ask for your careful attention to the potential impact on quarantining practices. We would be highly disappointed and frustrated if a change to the mask mandate would return us to the previous quarantine guidelines that resulted in a tremendous number of students missing days and sometimes weeks of school. Again, we ask the board to carefully consider the advice of state and national public health experts regarding any changes. And thank you for the opportunity to provide our thoughts and input. Sincerely, Dr. Patricia Salins, President, Kazam, Superintendent, Queen Anne's County Public Schools.
Thank you very much, Dr. Simpson. At this time, we're going to open it up for 15 minutes of clarifying questions from our board. You can direct your question to an individual, to a group like MAVE, or to the entire panel. So at this time, we want to try to give each board member an opportunity to ask a question. So we'll ask you to ask one question, and then if time remains, we will come back for a second. So if you have a question, please comment, whatever question, please let me know at this time. I've got everybody on grid, so I think I can see just about everyone. Okay. Mr. Bartley?
Are you just taking an inventory of who wants to ask a question?
Yes, I'm just saying if anyone wants to ask, I'm not trying to force you to ask a question, but if anyone has a question, this is an opportunity to ask a clarifying question of our panelists.
Oh, sure. I have a question from Melissa Williams of Washington County, correct?
Yes.
Melissa Williams?
Senator Williams.
Okay. Melissa, I don't know if I understood your comment or presentation correctly, but are you advocating on behalf of Washington County for the mask mandate to stay in place?
Mr. Bartley, I would say that a majority of the board members in Washington County are for continuing the mask mandate.
Is that reflective of the general populace and the parent-teacher associations at your most populous schools in the county?
I can't say that for certain. I will say that we have had a very vocal group, a very, what I would consider a small group of parents who have spoken in opposition to the mandate. But I think we're not hearing from many who are reluctant to come out to offer public comment at our board meetings because they don't want confrontation with those who are in opposition.
So when you say it's
Mr. Bartley, please, what we're going to do is we're going to make sure we have opportunity for others, and then we'll come back to you for one last question. Are there any other board members? I just want to make sure we give all board members an opportunity.
Yes, I do have a
Ms. Chang?
somewhat related question. Yeah, the one I asked in the prior panel discussion is about the education or ways of wear the mask. Was that information kind of widely available, distributed to all students and their parents? And somewhat related to that is that I heard that many counties that have a mandate, no negative tag per se, seems the students are really compliant to the rules. And for somewhat, they still have some kind of a small pocket of students, have difficulty. How would you handle it in a county-wide situation? Thank you.
Okay. So we'll direct that question to anyone from May that would like to answer it, and then also we would give President Bost, if she chooses to, comment on it as well. But if anyone from May would like to comment on that, we would appreciate it.
I'll speak. This is Virginia McGraw from Charles County. I can speak for Charles County in that we have on our website, standard operational procedures for COVID, which includes from quarantine, what we're doing for quarantine, wearing masks, what personal protection equipment we have available. So it's been in existence since school started for reference for our parents. I don't believe I remember the second part of your question.
How do you handle students that are not coming or have issues with mask wearing?
I'm going to be very honest and say that I don't feel informed to be able to give you that answer. I have not spoken directly with any of the teachers or principals on that matter, so I don't want to give you some misinformation.
Anyone else on the panel wish to comment on that?
I would just add that what we hear from our educators, many of which started the year with wearing masks and then were added, that nobody wants to wear a mask all day, okay? But they were doing it so that we could be in person learning. With the requirement to be in person, the desire to have the best quality education in person, people are willing to wear the masks all day. They hear that especially from students so that they can be around their friends throughout the school. There are issues in some places with enforcement. Some of it comes from students who say their parents say that they don't have to wear the mask, which doesn't help our educators to enforce the rules in the health and safety. So it would be helpful if we were all on board to do this for the benefit of everyone, but I can't say that it's event-free. Different school systems deal with the non-compliance in different ways.
Thank you.
And I would say in Carroll County, we were different. We started with the optional mask mandate, and immediately, the day after, everyone was informed through our chiefs and Superintendent Lockard of the change, and people complied. And I know teachers are vaccinated and they're tired of wearing masks. Students know it's mandated, they're tired of wearing masks. But we do have individual students that do not want to wear masks, and it is dealt with on an individual basis. And also, believe it or not, our school bus drivers are having difficulty with having the students wear their mask properly while they're seated. The bus driver needs to drive the bus and get our students safely to and from school, and now they've had that other added dimension, and they are trying to do the best they can, but that has been difficult also. So I'm very proud of our educators, our administrators, and Dr. Lockard and his staff. They've all worked well together, whether we want the mask mandate or not. we will get through this, and but our students have complied, our educators have complied, but of course we're in Carroll County and our parents want that choice. And thank you for my time.
Thank you very much. Ms. Morrow?
Good afternoon, and thank you all for joining us. This question really starts with Carroll County, but I guess could go to any of the superintendents. So we received feedback from Carroll County Health Department that is different than what the Carroll County Board of Ed has put forth in your resolution. How do you kind of look at that advice from the health department, and how does that factor into the decisions that you are making for the school board?
I did not get that information till late last night, and there are some questions about that information, and that's the only thing I can state on that right now. And I can definitely get back to you on that.
I guess just for any other members of MAE, do you feel like the boards of education, the county leadership, the county health departments are all working in conjunction, or is there kind of disagreement on these?
Ed Singer was absolutely wonderful. We worked with him hand in hand, and whether we all agreed or not, we all worked together during all of our meetings, and anybody can watch them. And we have a new person now who I personally do not know who sent that information, and I can get back to you if you would like me to for more information on that, because there were some questions about that I received today.
I will say that in Charles County, we work very closely with our health director, Dr. Diana Abney, on a regular basis. In fact, she just did a presentation at our monthly board meeting, month before last, in conjunction with our superintendent. So we have a very close relationship.
And I can say in Baltimore County, this is Makita Scott, we work closely with our county executive and our health department and with the superintendent to make sure that we are working in the best interests of the children and staff, and we follow the science.
I would like to say one thing though. When you're talking about the health departments and working together and all that, I find something that is very difficult for everyone in the whole state to look at is that Carroll County's dashboard keeps only current data, where the state keeps a cumulative. And I think a lot of things get mixed up, misunderstood with some of our dashboards and our information, and it needs to be updated. Ours is updated weekly, and I think that's another thing that does cause questions.
President Herbert, is it who maintains that particular dashboard that you were referring to?
Our central office does.
Okay, Carroll County.
Yes.
Okay.
Mm-hmm. Yes, sir.
Thank you.
But we work with the health department every day.
Okay, that's great. Any other clarifying questions from our board? If not, I'm going to go back to Mr. Bartley. Did you have one last question that you wanted to ask, sir? Well, I want to thank our panelists. We appreciate the information. We will take all of this under advisement as we try to figure out a thoughtful, reasoned way forward. And again, thank you for taking time out of your schedules to be here with us and to share with us candid comments. And thank you. At this time, before we transition to our fourth and final panel of national experts, we're going to quickly show the video from Dr. Chan, the Deputy Secretary of Health for the state of Maryland. Superintendent Chaudhary.
Sounds good. All right.
Okay.
Can you see my screen?
Yes.
All right. Let's hope that this works.
Hello, my name is Dr. Jinling Chan, and I'm the Deputy Secretary for Public Health Services with the Maryland Department of Health. And I thank you for having me here today at the State Board of Education meeting. Today, I'll be talking about the current case rates in the state, the impact of COVID-19 disease on children, and the newly approved vaccine for children 5 to 11 years old. Currently, the number of cases per population has been slowly increasing in the state, with our overall case rate at 12.9 cases per 100,000 as of November 13, 2021, just this past Saturday. There is variability across the state, however, from as high as 60 cases per 100,000 in Garrett County and other parts of Western Maryland to lower case rates in the National Capital Region. This is also related to the variability in vaccination rates across the state, with lower vaccination rates overall in areas where case rates have been higher. Over the last week, the cases have been increasing again. And as we go into the holiday season, this is likely a trend we will continue to see. So people should be aware of this and plan accordingly. While the impact of COVID-19 has undoubtedly been greatest among the elderly and those with underlying conditions, those who say that there has been no impact on children are just wrong. Many children do suffer from underlying conditions that put them at higher risk of complications if they get infected. And even previously healthy children have become infected and suffered consequences. Over the course of the COVID pandemic here in Maryland, there have been over 700 hospitalizations in children under 12 years of age. Maryland has also seen 158 cases of the multisystem inflammatory syndrome in children, or MIS-C, which is a post-COVID syndrome characterized by severe inflammation affecting the heart, lungs, kidneys, brain, and other organs. At the beginning of 2021, it's also important to note that as our campaign was just beginning among adults, only 6% of COVID-19 cases were under 10 years of age. But more recently, as more and more of the eligible population in the state have been vaccinated, the proportion has increased, more than doubled. So now it's 14 to 15% of our new cases are among children under 10 because they have, until now, not been eligible for vaccine. Lastly, up to half of children in the United States who contracted even mild COVID-19, that we are learning about the long-term impacts of COVID-19 infection on children. And so vaccines continue to be one of our most important tools in protecting this age group. So let me now move to talking about COVID-19 vaccines in Maryland. So to date, we have administered about 8.9 million doses to date. So 86% of people who are 12 years and older have now received at least one dose, with a range of between 56.7 up to close to 100% of people vaccinated across different counties in the state. This is compared to the US, where 79.4% of people 12 years and older have received at least one dose. The relatively high proportion of people who've been vaccinated in the state has already helped to blunt the continued impact of COVID-19, even with the Delta variant, in our communities. And we hope to continue that effort through our booster campaign and now 5 to 11-year-old vaccine campaign. So now, nearly a year after the very first Pfizer and Moderna vaccines were approved for adults, but just back in December of 2020, the FDA and CDC have approved and recommended for 5 to 11-year-olds to get the Pfizer-BioNTech COVID-19 vaccine. The Maryland Department of Health immediately authorized providers across the state to begin scheduling appointments and holding clinics to vaccinate this population. We are excited about this new CDC recommendation, and we've been planning with our partners like the Maryland chapter of the American Academy of Pediatrics, the American Academy of Family Physicians, and local health departments for months in anticipation of this. Parents can now feel relieved that their children can get a safe and effective vaccine and the protection that it brings for in-person learning and other important social activities. This vaccine is over 90% effective in decreasing symptomatic COVID-19 infections in the 5 to 11 age group, with just mild side effects that last a short period of time. In the pediatric clinical trials, side effects seen among children 5 to 11-year-olds were very similar to those that we have seen in adolescents as well as adults. Most of these common side effects were mild and lasted only a short while, usually resolving in about 2 to 3 days. The most common ones included swelling and redness at the injection site, along with tiredness, headaches, muscle and joint pain, low-grade fever, and chills. Some parents may also have questions about a rare outcome that has been associated with Pfizer vaccine, myocarditis or pericarditis. These are an inflammation of the heart muscle or of the covering of the heart, which can have multiple causes. But in relation to vaccines, out of tens of millions of people who have been vaccinated, the CDC and FDA have confirmed fewer than 900 reports of vaccine-associated myocarditis or pericarditis. It is important to note that COVID-19 disease itself has also been associated with myocarditis, and I would raise again that there have been, in Maryland alone, 158 cases of the multi-system inflammatory syndrome in children, which can also cause heart inflammation, and about 40% of these cases were among children 5 to 11 years of age. So as we ramp up our vaccination efforts for 5 to 11-year-olds, I wanted to note that there are 515,000 Maryland children who are now eligible to receive their COVID-19 vaccine. We've been working with a number of different partners across the state, including with local school systems, local health departments, pediatricians, and family physicians and pharmacies to ensure that there are multiple options for 5 to 11-year-old Marylanders to get this COVID vaccine. As of late last week, there have been over 36,000 vaccines administered for children in this age group already, with more happening over the weekend and in the weeks to come. We have received our initial allocation of 280,000 doses for 5 to 11-year-olds, with anticipated more vaccines to come in the coming days. We do ask for patience for parents who are looking for vaccine as we continue to work with our federal government and others in the supply chain to get the vaccines to all states in the most efficient possible manner. There are more than 300 vaccine providers for 5 to 11-year-olds, with more expected to be added in the coming weeks. There are a number of options for getting children vaccinated, including through the pediatrician or family practice doctors, through pharmacies, local health departments, and school-based clinics. And each of Maryland's 24 local school systems have indicated that they will offer some form of school-based clinics for their students. Parents and caregivers who are interested in finding a vaccine clinic for a 5 to 11-year-old can visit coronavirus.maryland.gov or call 1-855-MARYLAND-GO-VAX to make an appointment. So as parents, our children are precious to us, and it is our responsibility and obligation to keep them safe and to do all we can to protect them and give them the best chance to avoid complications from this infection. That is why, as both a physician and a mother myself, I have signed up my 2 children who are in this age group to get vaccinated, and we have been waiting a long time for this, and so we're very excited now as we go into the holidays to have this opportunity to protect my children who are 5 to 11 years old, and children across the state. We continue to encourage all Marylanders, including those aged 12 to 17 and also the adults, to get COVID-19 vaccine. As more populations become eligible to receive this vaccine, we urge everyone to get vaccinated to protect against the virus and its complications. Thank you so much for your attention, and I appreciate all of the work that everyone's been doing.
Thank you. That was very good. We're now going to move to our fourth and final panel. This will be a panel of national experts. We will ask each panelist to speak for up to 5 minutes, after which time we'll give the board an opportunity to ask clarifying questions. I will introduce each panelist one at a time, and then the panelists will then be invited to share his or her remarks. The first panelist we have is Dr. McBride. She's a practicing internist in Washington, D.C. with about two decades of experience, forgive me. She's a graduate of Harvard Medical School and Princeton University, and she's had internships at Johns Hopkins. She spent several years of emergency medicine, and she has published a number of articles. We'll post these bios on our website so people can look at them more closely. Dr. McBride, welcome, and thank you very much for taking time out of your busy schedule to be here with us today.
Thank you so much. I'm really, really delighted to be here and honored to be in the company of these distinguished other panelists. So yes, I see patients every day in my primary care clinic in Washington, D.C., and I've been writing a newsletter since March 2020, trying to help a wide patient population, and now 20,000 people every week, with real-time fact-based information to help people cut through a lot of the noise on COVID and how to, and with practical guidance on how to manage everyday decisions and how to think about their mental and physical health in tandem. I'm also a mother of 3. So the question of kids in schools is very near and dear to me. The questions that were posed to us by the board today were 3. Number 1, how to think about off-ramps for masks in school. Number 2, what do we know about the effect of COVID-19 on children? And 3, how should we be thinking about transitioning to living with COVID as it goes from a pandemic to an epidemic? So I'd like to start with question number 2, because it really frames a lot of the rest of the discussion. If we look at the data today in Maryland and we ask the question, how does COVID-19 affect children? The rate of hospitalization as of today in Maryland for children under the age of 18 is 1 in 100,000. And the total hospitalizations in Maryland are going down, have gone down by 11% in the last 2 weeks, even though cases are going up, which is evidence of the vaccines working. So the 1 in 100,000 hospitalization rate in children under 18 at this moment really tells you a lot about what you need to know about kids. While tragically, kids have died and needed hospital care from COVID-19, kids are generally at low risk. It is absolutely correct. It's false information to say that kids are not affected. Kids absolutely have been affected by COVID-19. I have seen it. I have witnessed it. But in general, kids are at low risk for severe outcomes from COVID-19. Most children experience mild symptoms, if any. Long COVID in children is absolutely real. I have patients with it, but it has proved to be less common and less enduring than originally thought based on robust data. Moreover, after vaccination, these incredible vaccines that, as just were discussed, are over 90% effective in children at preventing symptomatic infection. A child's risk of a serious case of COVID-19 is going to fall from tiny to infinitesimally small. I want to be clear, this is not to dismiss the suffering of so many children and families, but simply to contextualize the discussion around mandating masks for kids. So let's talk about masks. In 2020, it seemed reasonable. I was masking before masking was cool. I'm still masking with my patients. I'm wearing a KN95 mask with my patients, and I'm triple vaccinated. But now that we have these life-saving vaccines that not only reduce the risk of disease in the vaccine recipient, but that also reduce the risk of transmitting the virus to someone else, it's really time to think about removing a medical intervention whose benefits are not clear, and that does have harm. Masks are not a zero harm intervention. It's worth noting that the World Health Organization recommends against masking for children under 5, and it does not routinely recommend that children from 6 to 11 wear masks because they hamper social emotional development and learning. So in the US, we're really an outlier in masking children in these age categories. let's talk about the evidence, the scientific evidence, which is the birthplace of all recommendations I make in my practice to my patients. So 20 months into the pandemic, we still don't have clear evidence that masks in school are reducing transmission. So we don't know, even though some of the studies that are used by many experts say that masks are reducing transmission in schools, those studies are largely confounded by not controlling for vaccination rates in the communities. So it can look like taking masks off and case rates going up is because of the mask when it's actually the vaccination rates in the community. So when you control for that, like Tennessee did, and you look at a recent study out of Tennessee that did a control for when they controlled for community vaccination rates, there was no difference in neighboring counties when one school was masked and one school was not in the transmission rate within the walls of the school. Let's talk about the harms of masking. I mean, I think we would agree that if we thought that masks were doing a really good job of protecting our kids and protecting our communities, then we would mask indefinitely. But I think we need to recognize that these are not risk-free interventions. Kids need to see faces to learn and for their social and emotional health. America's most vulnerable children include those with cognitive delays, speech and hearing issues, autism, and English language learners, and these children are uniquely suffering. I think we need to acknowledge also that neurotypical kids need to see one another. We need to see each other as adults to relate to one another. This is a parallel pandemic of mental health and crisis. It's hard to prove that masks are the reasons why we're seeing such dire statistics in children and adolescents when it comes to mental health. But I think masks are the clearly visible intervention that we're seeing that signify that we're still in a pandemic. And it's evident that the emotional toll of the pandemic and the restrictions are significant when the AAP and the American Academy of Child and Adolescent Psychiatry together declared an emergency, a national state of emergency for adolescent and pediatric mental health. Now, those effects are not visible. Just like it's not, we can't see a lot of various effects. We can't measure as easily the effects on children, the anxiety, the depression, the social isolation, the bullying, the suffering behind closed doors. It's much easier to measure a PCR test or the distance between desks than it is to measure the emotional toll on kids. So when you zoom out here and you have a marginally, if at all, beneficial intervention whose benefits are falling further when kids are being vaccinated. In other words, as you vaccinate children with these extremely effective vaccines, the masks then become even less important. And when the harms are not zero, it's really time to reevaluate the reason we're mandating masks. Now, there will always be children who are vulnerable. My patients who are immunocompromised may always want to wear masks. I may wear a mask in perpetuity on an airplane because they can't. But mandating masks, harms are not zero, and the benefits are not clear and are getting less and less as kids get vaccinated. It's time to rethink this. So many experts, including include myself in this group, are recommending to think about off-ramps for masking once kids have had the chance to be vaccinated in this country, even if all children do not become vaccinated, as we know they won't. So many experts like Joe Allen at Harvard School of Public Health, my colleagues at UCSF, Monica Gandhi and Jean Noble, and a number of pediatric experts like Amy Falk and Danny Benjamin at Duke are recommending thinking about off-ramps for masking once every child in the United States has been offered 2 doses of the vaccine, so 8 weeks after they have been offered the vaccine. And you may ask, and the board would appropriately ask, well, what about if we unmasked today, which we're not going to do because we have this 180-day mandate of masks in school in place in the state of Maryland. What about quarantines? Wouldn't that then make we want our kids in school. And if you take masks off, we run the risk of quarantining more children when there's a case of COVID-19 in the classroom. And this is why, and I don't have time to talk about this, but I'd be happy to talk about it in the question section. I think Maryland needs to think about implementing the Test to Stay program, which is designed to fix an information gap. When a child, say in a second grade classroom, has COVID-19, we want to protect the exposed children. And we don't now, with the ability to test kids with these rapid tests, we have really very little reason to quarantine and send home children who are not sick because we don't know if they're carrying coronavirus. In other words, the test to stay program that's being employed in states like Massachusetts is something that I think Maryland and really the whole country should adopt in order to allow kids to stay in school even if they have been exposed to a case, because you can know in real time if that child is carrying virus in their nose in enough of an amount to infect another person in the classroom. So when we think about unmasking, we need to think about the practical implications and change the quarantining such that when you unmask, you aren't then quarantining whole wide swaths of the school because the kids are unmasked. I really appreciate your time and for listening, and I'm happy to answer any questions at the end of the panel.
Thank you, Dr. McBride. We appreciate that. We now have Dr. Swallow Burke, who is at Maryland chapter of the American Academy of Pediatrics, Vice President, let's see here, General Pediatric Practitioner at the Pediatric Center in Columbia, Maryland. Dr. Burke serves as the clinical instructor at Johns Hopkins. She has completed pediatric residency at Hopkins, and she received her medical degree in 1999 from Tulane. Dr. Burke, please, welcome.
Thank you so much. I appreciate it, and I want to congratulate you for pronouncing my name right. That's really special. That doesn't happen very often. So I just want to thank everyone for having me today. I also, as I said, on behalf of the 1,100 members of the Maryland chapter of the American Academy of Pediatrics, I just want to thank everybody for everything that we've been doing. I know that everyone here today is dedicated to the care and continued progress of our children, and really just to making sure that they're getting the best chance at a successful life. It's been a long 20 months for all of us. I have no doubt. I am a pediatrician first. I'm a general pediatrician. I see 20 to 30 patients a day from birth till their 22nd birthday, and I have to kick them out after they graduate from college or get a job. I'm a mom. I have a 13-year-old daughter who I was lucky enough, was able to stay in school last year. I live in Baltimore City. I practice in Howard County. So I also have been a member of the Maryland Department of Health on their meetings for planning for vaccine rollout. So I just want to, like I said, say thank you to all of you. I know this has been a long 20 months, and thank you for your dedication to all of our children. The first thing I just want to comment on is, we were discussing about, but I also want to thank the colleagues that are on this panel with me, all very distinguished, and I appreciate being included with them. I do want to talk a little bit about suffering, and I do think that one of the things that we talked about, and I've just heard beautifully spoken with about all the suffering that kids have had over the last 20 months. I mean, I have patients who have long COVID. It's not fun. I have a 14-year-old who can't climb the stairs at school. I have patients who've been in the ICU. I have multiple, Dr. Chan was talking about MISC. I have several patients who've been hospitalized with MISC, special needs patients. It's been a long time for us to live through this pandemic with our patients and with their families. As a pediatrician, it's a family effort. Just as educators, we're all on the same team. So it has been a long 20 months. We've seen a lot of suffering. The mental health problems that we see are astounding. My concern is that will be the longest lasting thing that we see out of the COVID pandemic. Will be the mental health issues that our children will be facing for years. We can't see that. I do think the mental health issue from the loss of contact, the loss of ability to socialize with their friends, with their family, the fact that most of them were not in person for a year. It's been a very long time. I will tell you, it's in anxiety and depression, even in my own, and actually, to be blunt, in the increase in the number of suicide attempts that I've seen in my patients over the last 20 months. So definitely, certainly, there's been a lot of suffering. The vaccine, I think, is going to be our answer. And I will tell you, if you want my one word for what the off-ramp is, it is a vaccine. Vaccines are now available and safe for children 5 and above. We've been giving them out here for the last 2 weeks. We've had a very good uptake of our patients. I mean, I'm in a county that has a very high uptake of vaccines, so we've been very lucky. But we've given probably almost 800 vaccines in our office in 2 weeks. So I really strongly believe the American Academy of Pediatrics is going to be recommending that masks remain in place in the classroom until everyone has had the opportunity to be vaccinated. I will say I think it's going to be longer for opportunities. It's going to be longer than just 4 weeks from the time that everyone's gotten the vaccine, because it's not universally available for everybody right now. It's hard to find. We're getting allocations from the federal government, so it is difficult for everybody who wants a vaccine to get a vaccine. There are also disparities for socioeconomic groups, for African American and Latino families, where just looking from the national average, the uptake so far with those particular populations has been lower. So I think we do need to look at some issues with vaccine equity and making sure that everyone has the opportunity to get vaccinated so that they can all stay in school. Like I said, we talked about this off-ramp, and we talked about the effect on children. The effect on children, I do agree that, first I will tell you that there's no one on this panel that wants to get rid of masks more than I do. I've been wearing N95 for 20 months now. And I have my own physical and mental issues from being in a mask for that long. But I do think it's important for us to keep, as the NDAP and the National UP say, to keep the kids in masks until we are able to get everyone the opportunity to be vaccinated, and we can start to look at progressing to the next step and the next chapter of dealing with with COVID as an endemic issue and not as an epidemic or a pandemic. I would love for us to get to the point where we're starting to think of it more like influenza and about getting our flu shots every year, about protecting ourselves. I will say that, one of the benefits of last year, except for the fact that children weren't in schools, we saw very little, which was great. We're already seeing flu this year. Kids are back in school. We're seeing other viruses like RSV, which is a very serious virus, especially for smaller children. So I do think it's important for us to have a plan. I think there will be a lot of important lessons learned from this that we can help with general public health to go forward and to think about that. But right now, until we get everybody with an equal opportunity to get themselves vaccinated, then the AAP would recommend for masking to stay in place. Also, just on a positive note, the vaccine rate for uptake for 5 to 12-year-olds in the state of Maryland went up from 4% last week to 12% this week. So we definitely are seeing a lot of progress. And as everyone else, I'm happy to take questions or any comments. And thank you to everyone for having me today.
Thank you, Dr. Burke. At this time, I'd like to introduce Professor Gostin. He is the director of the O'Neill Institute for National and Global Health at Georgetown University. He served as an associate dean for research at the Georgetown Law School. He is a professor of medicine at Georgetown University and professor of public health at Johns Hopkins. He is also the director of the World Health Organization Collaborating Center on the National and Global Health Law, and he's served on numerous WHO expert advisory committees. Welcome, sir.
Thank you very much. That was a mouthful, so I really appreciate it. I just want to say, first of all, that both of my children went through the Maryland system in Montgomery County, and I'm forever indebted. What a great school system! What a model for the nation. So I just want to pat you all on the back for a really great job in educating our children. I think it's really the most important thing we can do. I was asked to really talk about 3 questions: mask mandate, off ramps, what do we know about COVID in children so far, and and with more vaccines coming on board, particularly for children, should we be thinking of COVID transition from pandemic to endemic? I don't think I'm going to cover the second one about the effect of children so far, because it's been so beautifully stated by not just this panelist, but previous groups. I share with the board a very recent article in the Journal of the American Medical Association entitled, what every parent, practitioner, and policymaker needs to know about pediatric vaccines. And I urge you to read that, and I've sent the link. The bottom line is that, kids are absolutely not as great at risk, at least as a general population, unless they have particularly high risk, as the elderly or others in our society. But that doesn't mean that children have escaped the devastation of this virus. We've seen deaths, hospitalizations, and multi-inflammatory system syndrome. We've seen long COVID among them. And so this is a serious disease that we need to take seriously. But let me just look at the mask mandate off-ramps and third question on whether we should think of this as endemic. I've been working on mask mandate off-ramps now quite intensively, advising the president of Georgetown University as part of the Public Health Advisory Group. And we're a group of high-level people, including former FDA chief scientists and others. And we've determined for our own institution that we would continue with the mask mandate for certainly till the end of the semester, and probably we're going to recommend into the spring semester. I would make recommendation for Maryland school children, and I do that fully understanding how horrible masks. I hate wearing them, and I know that children hate them even more. I've got two grandchildren, and it's not pleasant or ideal or a good educational experience. But from a public health point of view, I think they're justified. And the question that the board needs to consider is if you believe that the educational and pedagogic and social and emotional well-being of the children so outweigh the public health gains of masks, that you would decide to loosen or withdraw the mandate. But I think on public health grounds, at this point, it isn't justified. The question is why. The reason we have really good evidence that masks work from major clinical trials, including randomized clinical trials with lots of people, and also experientially and epidemiologically. We've seen that apart from vaccines, which are absolutely our best protection, masks are the second most important. I would also add, ventilation when we can, as being quite important in the school system. And we don't have great specific evidence about the effects of masks in schools, but we have no reason to believe that schools as a congregate setting would be any different. Remember, teachers, staff, school children are in class for a whole day, many hours. They're sharing space with many non-family members. They're indoors, particularly in the winter. And so all of the circumstances for spread among children, teachers, staff, and then back to their more vulnerable families are all in place. Now, we are transitioning, absolutely, to an environment where there's more vaccination. And that will absolutely help. And the question is, you know, at what point, given the level of vaccination in schools, which is still fairly low, and also the case rates in our various counties in Maryland, that despite those changes, and as they may change in the future, removing the mask mandate from a public health point of view, not education, from a public health point of view, is literally evidence-free. That is, we have no evidence that taking off masks in the school system now would be safe. And so as much as I, you know, my heart yearns for these little kids that have to wear masks, I would say that at this point, I would be cautious. And that relates to the final point, the third question that I've been asked to answer is, you know, with vaccines becoming more available for children, boosters for adults, should we think of transitioning to living with COVID and thinking of it from a pandemic to an endemic? I think probably not. Now, I've been one of those who've been, you know, excited in the media a lot about, you know, when the pandemic will end. But I think most of my colleagues now believe that you won't get up in the morning one day and it will end. It will be a long process of acclimatizing to this virus, acclimatizing because our immune systems are better prepared through vaccination and exposure to SARS-CoV-2. And at some point, particularly with the advent of quite effective antivirals that the FDA is considering right now, that would prevent hospitalizations, we are moving in a transition toward living with this virus. But I think doing so too quickly is a mistake. History shows us that. We've seen this virus surge again. And while we're, you know, coping with a very, very dangerous and highly infectious Delta variant, there's widespread SARS-CoV-2 circulation globally, particularly, that could reseed themselves in the United States and make it more challenging for us. And so I do think it's wise to be cautious. I would absolutely start to have vaccines available in school clinics, nurses available to try to give vaccines to kids with parental consent. I do not think it's time now for school-based COVID-19 vaccine requirement, but one day it probably will be. But we don't have long enough long-term safety data, and the clinical trials pediatric vaccines were underpowered. There were few people there, and so I would be on the cautious side, and I would focus mostly on what I could do to, from the pedagogic and educational point of view, and the mental health and social well-being point of view, and wait and see how transmission of this virus plays out through the winter months, because we are headed toward a very cold winter, and the experience that we're seeing, particularly from Europe, are large surges, and that could be our case. We're never going to get back to the bad old days of very big surges, but I do think that there's another wave coming, and it's better to protect our children, our teachers, and our staff and their families. Nothing's more important than our kids and our teachers, in my opinion. So thank you very much for having me. I'm, again, very grateful for your careful thinking about the health and safety and the educational achievements and mental well-being of our kids.
What I'm going to do is I'm going to take liberty for just a minute and go back to our panelists. We've heard a lot of great information. give our panelists another minute or two if they wanted to do further comments, and then we'll open it up for clarifying questions from the board. But if anything, any of the panelists would like to make an additional comment or two, they're more than welcome to do so at this time. Just let me know.
I'm happy to chime in and just say that I think we really need to hone in on the evidence on masking. And I mean, like so many of you and so many of my colleagues around the country and around the world who care deeply about children and about our fellow citizens, I've had my finger on the pulse of the data. I certainly don't know everything, just ask my children. I have 3 teenagers, but I'm just not seeing the evidence that masks are effective at reducing transmission within the walls of a school. As I was saying earlier, and if there was that data, then that would certainly shift my thinking on the benefits of masking in schools. But so many of the studies that were, and I'm happy to pull them up, and you probably know them already, but so many of the studies that are cited, for example, by the CDC that say that masks are reducing transmission in the schools, again, are confounded by the fact that the studies didn't control for community vaccination rates. So it can look like when you take masks off and cases go up, that it's the masks that were keeping the cases down. In fact, it's the lack of adequate vaccination in the community. And when there were studies that were done that did control for community vaccination rates, again, comparing schools with masks and without, the evidence did not show that masks were that effective. I mean, I think we can agree that if you have a rip-roaring contagious second grader with COVID and that child coughs in an unmasked child's face, that mask is probably helping. But we're keeping, hopefully, kids who are sick home. We can now test with these rapid tests, and that is obviously a program that needs to be implemented fully in real time to know if a child is accidentally carrying COVID in their nose, coronavirus in the nose. And so it's just with the evidence being very weak on the effectiveness of masks, the burden of proof on whether or not the masks are helping at all, and what is the emotional toll that, again, can't easily be measured on these kiddos. I think it's important to recognize that, as my esteemed panelist mentioned earlier, the emotional toll is real. I'm witnessing this in my adolescent patients and in my community, that the suffering is real, and it's not being measured. You can measure suicide rates, you can measure the amount of antidepressants being prescribed to adolescents, but there's so much invisible suffering, and we need to finally recognize that health and well-being of our children is not simply the absence of COVID-19. It is about them feeling like they are living a normal life, and that they are beginning the healing process after 20 months of stacked traumas. Kids have lost parents. Kids have been suffering from various, emotional issues. They have been isolated from their peers. And I think we need to start recognizing that when you have a disease that right now in Maryland is hospitalizing 1 in 100,000 kiddos, and that is vaccine preventable, not perfectly, that once we get most kids vaccinated, or once the vaccine has been offered equitably to all children in the state, that masks are just not making sense. The burden of proof needs to be there, and the proof. I just haven't seen evidence that they're working like the way we think they are.
Yeah, I'm just going to respond very, very quickly. I respectfully but strongly disagree with Dr. McBride. I mean, the job of the school board is to follow public health advice, and I know there'll be pediatricians and others who are very learned and good who will say otherwise, but all of our public health agencies unanimously believe that masks are effective. I don't think that's even in question whether they're effective. Yes, the studies in schools have not been ideal, but as I've explained, there's no reason to believe that all of the wider, very robust studies don't apply in schools. And we also have good evidence from Korea and others that particularly young kids are really active spreaders of the disease. I do agree with Dr. McBride about the importance of balancing mental and emotional well-being. And those are kind of educational reasons, social service reasons, mental health reasons. Those are different, and they do need to be balanced, absolutely.
Dr. Burke, did you want to say anything? Otherwise, we're going to open it up to the board. You're muted, Dr. Burke.
You would think after 20 months I could have gotten that figured out. Sorry about that.
I can't figure it out either, so.
So, I just wanted to say, I just have really two quick points. The first is that, I do spend all day, every day with school-age children. And the thing that always amazes me, and the reason I became a pediatrician is because children, and probably the reason many of you became educators, children are just so much better than we are, right? They're more resilient. They truly just take things in stride a lot more than we as adults are capable of doing. And I will tell you, in terms of masking, I have almost none of my patients have a problem with it. Like, they really don't seem to mind. They practice, we give them some positive reinforcement. The other thing about masking, and I agree that as we get more kids vaccinated, obviously the goal is to get everybody vaccinated and unmasked and happy and playing and really back to normal. That's what we all love to be. But there was actually a study that came out it was just put in the AAP guide today, a Swiss study that basically showed that kids were really able to, sense emotion, that there wasn't a significant difference between kids sensing the emotion on their mother's face between masked and unmasked. I do think there are probably some people that doesn't work for. There are special needs kids who that is definitely more difficult. But I do believe the most important thing of all of this is to have all of our children in school every day as much as possible. And if that means that we need to be masked until everybody can be vaccinated, or we can get to a level that we feel like there's a safety with the level of people vaccinated, I do think that's what we should do. And I think really our focus should be on getting everybody vaccinated. That should be where we should be really spending our energy.
Thank you very much, panelists. Now let me open it up to the board for clarifying questions. We have Dr. Wilcox, and then Dr. Getty.
Hi, panelists. Thank you so much for taking the time to be here and to give us your guidance on this front. The two physicians, Dr. Burke and McBride, said something about specific. In terms of an off-ramp, you mentioned it's prudent to give everyone to be vaccinated. Please just give us an idea of what the timetable is for that. And also taking into account the issues of equity and access that were mentioned earlier, like tacking piece on. Can you give us an idea of how far forward that takes us in terms of weeks?
Thank you. That's a great question. And I wish at this point in time I had a really good answer for you. I think right now, especially, I was just before I came onto this call on a call with Maryland Department of Health. So as I said, I am in a very high take area. Howard County, the population of Howard County in terms of adults vaccinated is over 80%. The same thing with children 12 and over. So very high uptake, and we just basically, we can't get enough vaccine right now to vaccinate everyone who wants it. We're booking a few weeks out already, and that's for people who are ready to go from the get-go that we're, pretending that we're trying to buy contact and all that. So I do think it's going to be a while just before we have all the logistics in place where everyone can get a vaccine if they want one. And that's with people who have easily accessible health care, who have a medical home. A lot of the health departments will have them. A lot of the schools have already started. So I know in Anne Arundel County, they've had several in-school clinics, which is great. like I said, I just don't know right now with supply from the state of Maryland where we are, and we'll probably have a better sense of that in about 4 to 6 weeks in terms of that. I hope that answers your question.
Thanks so much.
Can I add on another thing about the vaccination? I couldn't agree more that equitable distribution of the vaccine is crucial, and that it will take time for all children to have access to 1, if not 2 doses. So I think we know from a recent Kaiser Family Foundation poll that, parents, even though the vaccine is to me clearly the right way to go and safe and effective, there's a lot of vaccine hesitancy. So, I worry that if, I don't think we can wait for 100% vaccination rate in children, of course, because I'm not sure we'll ever get there in this, heterogeneous, to put it mildly, country that we live in. So I think that, again, the reason to think about off-ramps now, even if you're not going to unmask kids today, makes sense. In the face of the fact that not every child will be vaccinated, not every teacher is going to be vaccinated, unfortunately, but I think we need to start thinking about what risks are we willing to tolerate, because again, the virus is going to be woven into the fabric of our everyday existence. Not that we want it to, but it will be no longer a pandemic at some point. It will be epidemic. It will be like one of the 4 coronaviruses we live with, like influenza, like RSV. Again, not that we want those in our life. We'd rather have none of them. We have animal reservoirs for coronavirus because it's spread by asymptomatic people, and because the vaccines aren't 100%, we're always going to have this virus in our midst. And once we've been vaccinated, we take the, as my friend Monica Gandhi says, the claws and the fangs away from it, and we can live with it. So when you have not every child vaccinated, as we can expect to happen, we need to think about what are the realistic off-ramps for an intervention that's not zero harm, given that we're never going to most likely achieve 100% vaccination rates. And I think that it's a good time to have these conversations. And once again, I'm thrilled and delighted to be on this panel with the esteemed experts in my company.
Marty, would like to now thank you. Dr. Getty?
My question is to Dr. Burke and Dr. McBride also. Dr. Burke talked about the off-ramp, the masking mandate being tied to the vaccination rate. And so what are we aiming for? How do we turn it into a motivational factor of the masks get to come off when you're vaccinated? You said there's hesitancy in this particular age group.
Well, Massachusetts, for example, is setting an interesting template. They are choosing to unmask, lift the mask mandate for vaccinated students and faculty and staff when the school has achieved an 80% vaccination rate. Now, I'm not sure I'm a big. That's one way to do it, and Massachusetts I think is en route to do that, and it'll be interesting to watch them and how that works out. Once again, so much of the studies about school transmission that controlled for community vaccination rates showed low transmission within schools. So, the more vaccinations, certainly the better. And I don't think you even need to get up to 80%. But, that's one way to do it. And Massachusetts is leading the charge.
I think there's going to be, unfortunately, looking at the state of Maryland, it's going to be difficult because every county is different, right? Every jurisdiction has a different uptake, and it really does matter about community transmission. That is important. We have basically across the country. It's a little bit better in Maryland. But what you do is you say there's a third of people that are going to be getting the vaccine the day it's available. There's a third of the people that are never going to get the vaccine no matter what you do, and there's a third of them that are somewhere in the middle, right? Those are the ones that we really want to focus on. And when I talk ones that I say, these are the ones that you're going to have to win one heart at a time. These are the ones that you're going to really have to spend time talking to. And I do think incentives are a good idea, and I do like the idea of having a goal. But science changes and we follow the numbers, and things that we thought, of course, things that we thought would be our goal for herd immunity 6-8 months ago are no longer what we think is going to be effective. So I think we also have to be willing to change as science changes, as we learn more. But I do think, like I said, there's the third, and the third. So trying to really focus on that, and that middle third, I do think would benefit, especially when we're talking about parents, right? It's different when you're talking about adults who can make their own decisions. But for parents, they're really worried about their child. So I think that third in the middle, we handle with some kid gloves, and we give them really good information, and we work on convincing.
Mr. Barkley?
I'd like to thank the panel for the great information. I'd like to especially thank Dr. McBride. Your presentation was outstanding, and the research time and effort you put into your presentation should be heard by all America. I'm surprised I haven't seen you on national TV.
I've been on TV.
Oh, you have? Okay. I missed you. But I really like the fact that you balanced your research with regards to the case study in Tennessee, with regards to mask, where there were high vaccination rates, and mask where there was low vaccination rates. And I also like how you balance that, the fact that there's the idea there's no harm with mask is wrong. And you also balance the reality that we're going to transition from a pandemic to an endemic, where we're going to live with this coronavirus for the rest of our lives, more than likely. And I also like how you balance the opportunity for vaccination and the off-ramping of mask. Do you think that more people are concerned about the harm children will do to their parents and their adult loved ones, as opposed to the harm that children will do to one another with the mask? Because I think you're saying one in 100,000 go to the hospital with coronavirus. How does that compare with the flu? Thank you.
Well, thank you so much, and I should spend more time with you with all those lovely compliments. It gets me in trouble every time I talk about comparing with the flu, because it depends on which age group we're talking about, and it depends on which flu season we're talking about. But certainly, many people have compared apples to apples, with saying the flu and coronavirus are very similar in the way they affect children. Now, they're not the same. And it depends on the season of flu, and it depends on the age group. But we have to remember, as I think you're alluding to, we don't mask kids and isolate them from their peers and, block off communication from their teachers and coaches during flu season every year. Whether or not we should, as a society, quote unquote, tolerate the death of, 40 to 60,000 Americans every year from influenza is something we should really think about as a society. I mean, I think we've learned a lot about how much we affect each other and how much.
Pardon me just a second. Please mute your devices.
So I think we've learned a lot about, the toll that our actions have on other people. I think maybe in flu season, particularly high-risk people will decide to mask because they are particularly vulnerable to influenza. Like I said, I might always mask on an airplane in flu season. But I think what you're getting at is my main point, which is that we need to carefully balance the benefits of masking, which again I think are not zero, against the harms. And just because we can't measure the harms as easily as community transmission and death and hospitalization rates doesn't mean they're not there. And I think you're right that if I may say so, I would say that I think if I can say this, catering almost to the anxiety of adults by continuing to mask children. We know through abundance evidence that children transmit the virus less than adults do. So they carry less virus in general in their noses than adults do. Now, if they're floridly ill, they're going to transmit just as much as an adult will. But just, you know, if we compare generalizing kids to adults, children are less able to transmit. And so I think a lot of people naturally are worried about kids infecting their teachers, kids infecting vulnerable members of the school community. But we have to remember that those adults can protect themselves with vaccination, and certainly by getting boosted, which I'm recommending to most of my patients. And so I think we need to keep our own fears in check and use the science and the data in the driver's seat of policymaking, and not our own fear of the unknown. And I think I worry that we're just waiting and seeing is doing a lot of harm to our children that could last generations, and is, again, difficult to measure and see.
Are there any other clarifying questions from the board? Okay, we're going to go first to Ms. McCusker, and then back to Dr. Wilcox and Ms. Chung.
Thank you, and I'm kind of piggybacking on what Ms. Chung had been speaking about today, and I was wondering from the experts, since children are currently masked in school, and we were hearing about masks getting wet and yuck through the day, as public health and doctors, what do you think is a reasonable solution for that? Do you think kids should be changing masks midday? Is that something we should be recommending to families? Does having a wet mask make it less effective? Does it increase infection? I mean, can you talk to me a little bit about that? Because certainly as a teacher, I see the masks get wet, and sometimes they're kind of gross by the end of the day, to be honest. But, you know, how can we help educate our families to help children while they are currently in the masking, to do it properly and in a way that keeps them comfortable? Because they can't possibly be comfortable when it's wet on their face.
Go to Dr. McBride and then to Dr. Burke.
Yeah, so I think that's another example of, first of all, how gross masks can be, and how it sort of makes intuitive sense that the masks aren't probably working as well as they could when kids are tugging on them and they're wet and sloppy. So I don't have a great answer of whether or not they should be changed out, because I think it's pretty clear now that I've been talking a little while that I think there is utility to masks in certain situations. It's not that they're not helpful, but I think the utility of them goes down, and we've seen that in children, and the evidence shows that the transmission is not necessarily reduced in schools that don't have masks, and that as kids get vaccinated, the utility of the masks goes down even further, because the vaccines basically do a much more robust job of reducing transmission than a wet mask does.
Dr. Burke, thank you.
I apologize. My internet decided it was going to go out a few minutes ago, so I apologize if I disappeared briefly. So generally for us, just with recommendations, as long as we're still having children masked, we do recommend that if it becomes visibly wet or visibly soiled, that they change it. There is a decrease in the ability of, if you're, with mask and transmission, and even with us, right? So if it's visibly soiled or visibly wet, then they should change their masks.
Thank you.
Thank you, because I do want them to be as effective as possible and as comfortable as possible.
Right. Yeah, no, it's not comfortable, and I will tell you that for when the pandemic began, we were re-wearing our N95 masks we had them on a rotation, and it is not fun to put on a mask that has been used before.
Okay, thank you. We'll go now to Dr. Wilcox and then to Ms. Chung. And we will also just do a time check after Ms. Chung to see how we're doing. We said we were going to conclude about 5:15. I know some of you had indicated that you had commitments this evening, so we'll do a time check, sort of a sense check at that time. So Dr. Wilcox and then Ms. Chung.
Just a really quick question. Thanks again, everyone. I'm just curious about whether flu.
Dr. Wilcox, we may have lost you for a second. Let's go to Ms. Chung, and then we'll come back. Hopefully she'll be back online. Ms. Chung?
Thank you so much for the panelist presentation. And I think I want to ask a critical question about the public health, justice, and the non-zero harm mandate masking. You know, what's the tipping point to go either way? Thank you.
I'm going to, if I may, I have to drop off, and may I let the two physicians carry on from this panel?
Yes, sir. We really appreciate your contributions. Thank you so much.
You're welcome. Thank you.
We're going to be ending shortly because to be sensitive and to everyone's time. So the tipping point is the question. At what point? So Dr. Let me see, I think we did. So we do Dr. What did we do last time? I'm just over 70 years old, so I sort of need. Okay, so whichever the doctors would like to start, the other one can comment and chime in. Thank you. Please. Dr. McBride, go ahead and then.
Sure. So I think you're asking about the tipping point of masks.
And then a mask.
And the mandate of the mask.
Health.
So I think we have to, it's a great question, and I think we want to frame it in this way to think about why do we wear masks? We wear masks to protect ourselves, and we wear masks to protect other people from ourselves. And I think, as we've been talking about, it's important to understand that children wearing masks, we're masking with the assumption that we are reducing the amount of virus in their nose that can get to someone else and infect someone else who might be more vulnerable than the child. But when we know that children tend to spread the virus less than adults, based on numerous assiduously done trials. Number two, we know that when kids are vaccinated, because the vaccine reduces the risk of transmission, the vaccine helps us not get sick. It also helps us not transmit the virus to other people as much. And then when the harms are starting to add up, I think the American Academy of Pediatrics, as I said earlier, declared a state of national emergency for child and adolescent mental health. I think because, as we all know, the pandemic and the restrictions themselves have had enormous emotional costs and are ongoing. I think we need to think about, as with any medical intervention, with any medication I prescribe or any medical device I prescribe, we want to think about always what are the risks and what are the benefits. And when the benefits outweigh the risks, even if it's a small amount, then we recommend it. And so as the benefits of masks go down, as kids are getting vaccinated and the harms are going up, and we need to think about that exact thing, the tipping point. And I would argue again that it's once all children in Maryland have had the chance to be vaccinated.
Dr. Burke?
Thank you. So, I agree. It is a balance, right? We're looking at what are the pluses and minuses, and there's never going to be a perfect answer, and there's never going to be an absolute number. And I wish I could tell you when you get to this number, this is the number you need, and all will be good, because I don't think it is, and I think it's a moving target. If I could tell you a number today, that in 6 weeks it could be different. I do think it's really important to let everybody get vaccinated, to give everybody the opportunity to get vaccinated, to really not only to have them have the ability to be vaccinated, but have them have the ability to have discussions with their doctors, with people that they trust, so that we can really try to optimize the number of children that we can vaccinate in the state. I do agree, I wholeheartedly agree with what Dr. McBride was saying about the vaccine, about mental health issues, and certainly that is an issue. I personally don't think that is connected to wearing masks at school. I think that wearing masks at school or being able to have extra layers of protection, I know from a lot of my families, just to allow them to go in. I think the reason that we're having the mental health crisis is because of the fact that they weren't in school, the fact that there were lockdowns and things that were really maybe appropriate under public health measures. worse during the beginning of the pandemic. So I do feel like it's important for us to balance that. So I would agree that the tipping point for me would be once every child in Maryland has the opportunity to be vaccinated, they've had the opportunity to have time to discuss this with their pediatricians, with their other healthcare providers, and that we can just, I think that the debate about masks is important, right? We talk about this, everyone's going to have, we all have different opinions, we all have different data that we're going to refer to, but really the answer to this off-ramp question is vaccines. Like, it just, it doesn't matter if you're a pro-mask person at school or a anti-mask person or a somewhere in the middle person. The answer to getting our kids out of masks altogether is to get them vaccinated, period.
I agree, and I'd love to just add one more thing, Dr. Burke. I think that I agree with what you just said. Lifting the mask mandate, of course, doesn't mean kids can't mask if they're particularly vulnerable, just like a child who has diabetes is going to take extra care in the classroom, or a child who has a special medical condition is going to take extra care. My immunocompromised patients, got booster shots immediately, well before people who are at lower risk for outcomes from a breakthrough infection. In other words, we're always going to have people at different risks. But a mandate, lifting the mandate, just to state the obvious, means that kids who aren't at particularly high risk, which I would argue is most kids, don't have to mask, but people can still mask at will, and take into consideration their unique their unique health considerations, with their doctor in tandem. And the second thing I want to say is, it is hard to prove that the masks are related to the mental health crisis, but there have been so many stories. I mean, I talk to adolescents every day. I talk to my adolescents every day, and the ones I talk to are pretty uniformly like, this stinks. This is awful. I can't see my teacher's face. I can't understand social cues. I don't know if this girl is rolling her eyes at me or if she's laughing with me. We're just not wired as human beings to be cut off from the face, from the nose down. And so,
what I would like to do, if I can, if you don't mind, great points. I want to give Dr. Wilcox an opportunity to ask her question, and we'll close out with it. The comments, the suggestions, the ideas, the thoughts, just outstanding. You've given us a lot of things to think about, and I just want to try to, again, be respectful of people's time. We said we finish at around 5:15. We're a little bit beyond that, but I want to give Dr. Wilcox an opportunity. The panel, you guys have been outstanding. Dr. Wilcox.
Sorry, I don't have less time, and thank you for giving me the opportunity to ask, but I was just curious if flu season is going to compound the risks of COVID in the community and in young people specifically, and if you guys could weigh in on that, I would appreciate it.
Yeah, I think flu season, I'm more honestly worried about flu season in my own kids and my adolescent patients and in my adult patients, because the coronavirus vaccines, the COVID-19 vaccines, are so highly effective against severe consequences from the virus. And the flu shots are highly, highly effective. And I'm recommending flu shots for everyone. Run, don't walk to get your flu shot today if you haven't already. But the flu is a potentially serious disease and certainly can affect kids in some ways more than COVID-19 itself. So I do worry about it. And I think, I think it could be a tough winter, but I think it's also just, as we think about the flu, we think about the flu being around every single winter and how we deal with it. And we don't close schools, we don't mask kids, we don't have to have, kids with soiled masks and friction between teachers and bus drivers and, just tension in the classroom because of, enforcing mask rules. We should think about how to manage COVID-19 in a way that isn't organizing our whole life around a single pathogen, while respecting the fact that the flu and coronavirus do affect kids and they do cause severe disease and destruction in particularly vulnerable people, which is why we all need to get vaccinated. So that's it's a long way of answering your question, but I am concerned about the flu.
And Dr. Burke, we're going to give you the last opportunity. Are you still with us, or did we lose? We may have lost her. I know she had mentioned that she was having some internet challenges. Well, on behalf of the Maryland State Board of Education, we really would like to thank our panelists, our expert panel, but also the panelists earlier today and the public comment. We were hoping to get a cross-section of views and perspectives. I was disappointed that we didn't get a silver bullet that just said, just do this one thing and it's done. But we have a lot of good information to think about. I would urge the board to remember how we started down this path, and our goal again was safe return of in-person learning for children and staff, and do it in a way that minimizes disruptions. So as we look at this, I would urge the board to review the today's meeting. Take the time to read the letters and emails that we received from parents and experts and education officials and health officials, and take a couple of weeks to think about this. We're going to come back together in early December, and that'll be an opportunity for us to share and talk about what we have heard, where we're thinking, and then with the idea of coming to a decision. And I think, again, what we need to do is take all of this information into account and then come up with a thoughtful, appropriate way forward as best we can, with the idea of fulfilling what we said was our objectives. And again, thank you so much for this. I would at this time like to entertain a motion for the board meeting to adjourn. Do we have a motion? Senator Bates, and seconded by General Sumter. Open for discussion. Seeing no discussion, I ask the board members to turn on their devices. All in favor, please say aye and raise your hand. Aye. 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 Opposed? Again, thank you very much for everyone, and thank you, our last panel. We appreciate it.
Thank you very much for having me.
Thank you.
Bye.